if you could please make reference to pages with the online version so that everyone in the room can understand it. And just to be clear, just because you know where you are doesn't mean everyone else does in the agenda. So please, if you could make sure we can narrow it down a little bit more, it makes it easier. If you wish to speak, please indicate by raising your hand and I will come to you in the best order that I can. The meetings are being recorded for record. And finally, as agendas are published, we've done that one, we refer to page in them. So as far as I'm aware, there are no fire alarm tests or anything. We can now go and come together out in the well if the fire alarms operate, so please make your way to change. Before we start the meeting, members, I did a review on Friday of the agenda, and because of the way that the agenda was put, I've made a couple of suggestions to officers to change it. I think the reason that the family hubs item is coming to us, I think, is because of the important nature of it, and we need to go through it. So I've asked and I've readjusted the agenda. So what we're going to do after our outcome tracker, so the first substantive item of the agenda will be family hubs. What we will then do is then revert back to the agenda, so in effect it will be 1, 2, 3, 4, 5, then 9, then 6, 7, 8, etc. The idea behind that is so that we can, I didn't want family hubs to be the last item, because some of you may be in a hurry to get out the door at that point if we're heading for 7 o'clock this evening. Otherwise, we'll do what we can. I want to give every item the best attention that it can, but we're going to try and condense a couple and fill a bit more in. This will take Claire by surprise because she came in the room, but obviously since our last meeting the white paper has been published. What I was looking, we have an item on the agenda for SEND self-evaluation framework. I didn't know whether anyone would maybe want to insert a little bit into there and in our initial take on the white paper and the stuff. I'm sure that the members in this room and the officers in this room are still trying to read through the multitude of stuff and the clarification that's coming out on a regular basis. But it just may be useful for us to just make reference to it. I'm sure it will be the subject of many a conversation over the next few months, years, etc. Okay, are we all seated comfortably? Agenda item 1, apologies for absence, please.
Thank you, Chair. Good afternoon, everyone. We received apologies from Councillors O'Donnell and Snell, and we have Councillor Hendry join us online.
Thank you. Are there any other apologies that I'm not aware of? Any substitutions that I'm aware of? No? Okay. Moving on. Agenda item 2 is minutes of our last meeting. I know that there were a couple of minor issues that have been identified, and also a point that I wanted to make is around outcomes. The outcomes from our that meeting weren't necessarily included, but I think, Ayushi, are we making sure that they're being published separately so that we can include them in that? So with that mentioned, are there any other points or issues that anyone would like to raise? Are we happy that I signed them as a true record, subject to the changes that we may need, minor changes that we made? Jack.
Chair, can I just say that if there are any minor amendments which are not going to affect the actual minute or the minutes of the meeting, then please send it to me and Ayushi, and we will make sure they're included in the set. Thank you.
Thank you for that clarification. Okay, so any objections? Oh, sorry. Oh, thank you, proposed. Thank you. And are there any objections? No, that's right. That's that done. Moving on then, item 3, declarations of interest and opportunity for members to make any declarations that aren't already predetermined in their register of interests or otherwise published in relation to what may happen today. Just one quick one from me. Then it is now on my register, should be on my register, but just to cover myself, I am, as of last week, I've been nominated and accepted as a trustee of the National Youth Agency. I sit on there as an LGA representative, which is a really exciting opportunity considering where we're going with the youth things there. Otherwise, that's that. Ruth.
This will be a temporary one, hopefully. I'm doing some work with the NNPCF on response to the white paper representing the Southwest. So I just wanted to add that into the mix.
Forgive me, I would be wrong if I didn't draw you up on the acronym.
Sorry, National Network of Parent Care Forums.
Perfect, thank you. So registered. Okay, moving on then. Agenda item 4, public questions. I'm not aware of any, and I don't think there are. Okay, moving on. Agenda item 5 then, our outcome tracker. That's been published. I've made a note that between now, obviously from the last meeting to this, there's been a short window and there's been minor issues in relation to the council budget that some of us have been drilling down on. So what I will say is, members, that I will ask Jack and Ayushi to come together with the vice chair and myself just to run through, first of all, the outcome tracker to make sure that that's picking up and helps us set our future agendas and our forward work program. So formally, Ayushi and Jack, if we could come together between this meeting and the next one to allow us to do that, I would appreciate it. Otherwise, are there any other points to our outcome tracker? Okay, there we go, off and running. Item 9 of our agenda, the next item of our agenda is going to be item 9, as previously signposted in relation to the family hubs. I know that I'm pleased to say many of us in this room have already been through the presentation in relation to it. Obviously, at that point, there were elements that weren't necessarily clear and substantive, which is why we wanted to bring it back to this meeting so that we can make sure that it's formally covered on our agenda and we get an opportunity to feed into some bits and bobs in relation to it, and also for it to be seen as, I would suggest, the more public launch in relation to what we're doing. The opportunity for family hubs, which you all know about, I've said about it, is really exciting, and the opportunities attached to it to link in with so many other aspects of our work within children's services at the moment, drawing together lots of different elements. It is, I truly believe, that one of the best opportunities we've had for a very, very long time. I've said it before, but I'll just reiterate now. Obviously, the term family hubs, and forgive me, Rachel, I'm not stealing any of your thunder, the term family hubs is a bit confusing, I think, or can be, because this isn't about putting buildings or things in place, in effect creating hubs. There will be hubs where they can feel, but this is more about a system change. It's bringing together the things we already have in our communities and putting together, I believe, an opportunity for us as a council to get officers in place in those places to go to take the services that we need to provide to the people rather than expect them to come to us. So I would call it a family system change as opposed to, or, and I'm allowed to say this because it maybe Sure Start 2. But we need to go careful where we say with that, because one of the learning points from that Sure Start was very clear. Some of the learning from that was that people spent too much time putting the buildings in place and not enough time with the service. I think putting the cart before, the horse before the cart in this instance, in the right place, is a better way of doing it, which is why I make a point. So thank you. Heather, did you want to introduce before I hand over to Rachel?
It'll be really super quick, just to remind ourselves that on the 14th of January, we were in here getting a really good presentation about the Best Start in Life family hubs and how far we got and what we're expected to do. So this really is an update from the team, and also an opportunity, as Chair's just said, to actually make sure that in public we ask any of those really strategic and leading questions. Discuss it as much as you want to, but it's building on what I hope that you remember from the workshop. So I don't want to say much more than that, but other than to underscore what Lee has just said, our chair's just said, about what a hub is and what it isn't. That relationship between all the partners in the community is the most important thing. It could be across 5 different places, 1 different place, it doesn't matter. It's actually about how we do things rather than the room we do them in. So I'll pass over to Rachel now, if that's okay. Thank you.
Thank you, Chair. So I'll provide an update today, as Heather said, on the back of the workshop we presented in January. And I'd just like to highlight the national expectations of the Best Start in Life programme, and also what this means in Somerset and our progress so far. So just to remind you, the national policy outlined a Best Start in Life programme with a real emphasis on joining up services and supporting parents from pregnancy to 5. There's a particular emphasis on school readiness and improving good level of development in children, with a bespoke target for Somerset set for 2028 of an 8% increase in good level of development. And there's a general recognition that this period is absolutely critical in a child's life because it impacts on the future trajectory of their outcomes, which is great. So it requires a family hub model. Really pleased to hear Chair's explanation of what that is and what that isn't, because it is about a system change. It's not about physical buildings. I think we have talked about our uniqueness in Somerset, the rural geography, and how we service that rural geography and provide the right support to all families in Somerset. So it will be a network of support. It will, however, include some physical family hubs. And it sets out some key expectations and elements within that programme, and that is a new set of interventions around parenting and home learning, a real emphasis actually on parenting and home learning, and high quality early years education, and an integration of services, as we've already mentioned, from health visiting, midwifery, infant feeding, parent-infant relationships, and early language development as well. So all those elements are core to this national programme. Locally in Somerset, we've done lots of work over the last 6 months in this development phase, engaging with partners. We are in the process now of writing our best start in life strategy that will be published at the end of March. That strategy will outline our approach to family hubs, the integration of services, and how we will meet that GLD target. We will also in April be ready to deliver parenting and home learning interventions, but this approach will be incremental. So we will make a start and then there will be an opportunity to build on that as we engage more with partners and key stakeholders and parents. We've already identified a family hub area in Wellington, and our next focus is on Bridgewater. There is learning in this approach. So the funding we will receive from the DFE it is not for capital funds, so we need to use existing resources. So we will have slightly different approaches in different areas, and as I say, that will provide learning so we can upscale this model across the county. But a key element as well is having spokes in various different community assets such as libraries, etc., and outreach into people's homes. Key to this programme is absolutely embedding parent and community voice, so that will be part of the strategy, and also ensuring that we've got really good governance and communication systems so that all key partners can work with us within this programme. So next steps for us as we write the strategy. By the way, the strategy will be a live document. It's not a done deal in April. That will be a strategy that's published, and that's the start for us all to sort of develop that work. But next steps for us are around data, so continuing to track the data and track children's outcomes to look at where we need to focus our resources, and strengthening that integration between services locally. I will stop there.
Okay, so I've got a couple of questions. So you talked about GLD, good level of development.
Yeah.
So could you give us a little bit more information about that? What it is and explains, because I think one of the points which I wanted to try and drill down on is about the localized element of this. So we've got because the next question is going to be, you talked about having something in place in Wellington already and potentially Bridgewater. I think, without wishing to put words in your mouth, it's just to understand in my head, and I think with members' heads, the fact that what I think is going to happen is that we'll start off with a little bit here, a little bit there, and then grow with that. But what it will provide us with, I suppose, is a template or a number of jigsaw pieces. And I think that, and so are you saying that what you were doing, we're going to be learning as we go, little steps, but then be in a position to be able to put the bits we know or the bits we need around each of the hubs going forwards?
I think there's a learning element in terms of the family hub model and the approach we take. Alongside that, we need to make sure that there is a proportionate approach to the support we offer to parents. So there needs to be a universal offer as well that is available to all parents, with enhanced support for those that need it most, and that will be across the county. So whilst we want to look at learning within the physical family hub model, at the same time we will be looking at how we provide parenting and home learning support across the county at a universal level, but also, as I say, more enhanced for those families that have got greater need.
GLD?
GLD, so GLD is good level of development. We currently measure child development when a child is 2. We also measure child development at the end of reception year. The government have chosen that measure of good level of development at the end of reception year to measure this approach, if you like. It's a proxy measure to measure this approach. It's very important that child development improves, but it's a good marker for the government to see how well our interventions that we're offering early are working. In terms of where we are in Somerset, our good level of development for children at the end of reception is actually above national average, but it could be better, as all areas can. So we need to achieve an 8% increase on that. I mean, I'd like to see an increase across the board for all children, but we will make an 8% increase. Our good level of development for children at 2 is slightly below the national average. That could mean a number of things, but again, we will strive to improve that as well, because we can start very early in maternity services, and when a child is born to target that 2-year GLD target.
So, sorry, Members, I'll bring you in. I just wanted to make sure we could cover a couple of points before we go. So just to be clear, am I right in understanding that one of the targets that government is setting us is an improvement in GLD?
Yes, it is. It's an improvement in GLD at the end of reception year, and that's for all children in the county. That's an 8% increase for all children. There is also a target around children who are in receipt of free school meals, so we can address disparities that we know we've got in the county.
Thank you. I've got a couple of more points, but if they're not picked up going around, we'll do. So Councillor Clayton. Peter.
Yeah, we've got a lot of names for these situations that we've created over the years. We've got Sure Start, Fair Start, Family Hubs. The police started something in Highbridge. Why is this one different? And how will this one work where all the rest didn't actually achieve what it was trying to achieve? An 8% increase on some children isn't going to happen.
Do you want me to answer that? Yeah. I think we've got to take the evidence from previous projects. So I mean, there is a strong evidence base that came out of Sure Start. This isn't Sure Start again, but we've got to use that evidence around what works. The DfE this time have been quite prescriptive in what we need to deliver. They've selected interventions that have been tested and have got strong evidence base for improving good level of development. So I think if we take a strategic approach, we can make a difference, but I think the really important bit is that we join services up and that they make sense for families, because at the moment they don't necessarily make sense for families. So we need a really clear pathway, but using evidence from previous programmes is key. And we have to try. You know, we've got to do something.
And I think so. You mentioned a number of hubs, but then you've got the DWP hub, you've got the youth hub, there are lots of different initiatives coming forward. And I know I've spoken about it before, but it is confused. It confuses me, let alone anything else.
It is.
Which is.
And my plea would be as well, we've been asked to call this programme the Best Start in Life Family Hubs programme, and if we can all use that language, that might go some way to have some clarity around it. But I think if we can use the language Best Start in Life Family Hubs approach, that would be great.
Sorry, did you want to come in, Claire? Go. Probably have to knock your microphone off, Rachel, please.
I just wanted to respond to what you were saying, Chair, about how many different initiatives there are, and the councillor's perspective on that too. There are a huge number of initiatives, which are, even to me, quite confusing on occasion. I think the fact that we now have the Achieving and Thriving white paper document and the SEND consultation document does start to bring it into focus a bit more clearly. It's like the final piece of the outline of the jigsaw. So I think we will now, obviously your media today will be able to give you an outline of what that white paper and the SEND consultation says, but I think in future meetings we'll be able to give you a much clearer picture about how all these different initiatives come together, because this is the big document that sort of starts to make a bit more sense of how all these different things work together. I think one of the really important things, though, as Rachel said, is that the family hubs work is will be different in different parts of the county. So this is not a one-size-fits-all approach. And I think previously that has been some of the problem. With Sure Start, it was like you have to do it like this, and it has to look like that. Whether you're rural or urban, whether you're in a deprived area or a sort of wealthier area. And we have learned a lot from that nationally and locally. I think particularly in relation to the rurality in Somerset, that a sort of building does not work well in a rural area, and a hub and spoke model so that we've got outreach going into those deprived communities and rural areas is absolutely critical to this model. And Rachel actually has talked quite extensively to the government about that in the early stages of this process, and they do appear to have listened. So they're not being so prescriptive about having these sort of individual buildings and everybody having to go to a building in a particular area, which is helpful. But obviously in every area, every local authority area, there will be different levels of need in different communities for different age groups, different types of children and different families. And we need to make very sure that the localities work that we're doing, which is based in the Families First partnership, which is smaller geographical areas in the county focused around schools, that we're really clear about our understanding of what does that locality actually need, and that we've got community voice in those sorts of pieces of work. So we're listening to parents, we're listening to children to understand what it is that they feel is needed in their local community, as well as what data tells us is likely to be needed in that community, so that the services are focused on what is required for those children to improve their outcomes both educationally and socially, in terms of trying to keep children at home and in school, rather than putting a one-size-fits-all model across the county, which we know from previous iterations hits a small number of children, but actually does not hit the number of children that we actually need it to. And the ones who really need that support in an one-size-fits-all model are lost to the system effectively, because the data does not pick up those needs for those groups of children.
Thank you. And you talked about picked up a point, because one of the things, we've got members in the room from all different parts of the county, and we're talking at the moment about potentially a Wellington and a Bridgewater initiative. I think, Rachel, one of the things that we mentioned in the workshop we talked about, it was some sort of community asset identification, because one of the things I think is important is we need to put, back opportunity, because each of us as members know pretty well what goes on in our area, but there's no central way of recording that. Are we talking about some sort of asset identification or community-based call for action or something like that?
Sorry, we have started some of that work through the localities work, but I think as we develop this programme, we can focus that down for 0 to 5s, and I think that would be a really key element of the programme.
Thank you. Councillor Hadley, Andy.
Thank you, Chair. I come from the West Somerset part of the county, and we have in the past been identified as one of the most deprived areas, if not in the county, in the country. Reading this, we're looking at Wellington, Chard, Taunton, Yeovil, Highbridge, Glastonbury, Wincanton. There's no mention of anything anywhere in West Somerset. If that's going to be included, I know it says Wellington and West. Does that mean Wellington and West Somerset? If that's the case, can we go back to the the language that we use to explain things and not just call it Wellington and actually say it's Wellington and West Somerset, so that people in West Somerset know that we're not being left out and forgotten again.
Yeah, thank you. It's a good point. In terms of those boundaries of those areas, that will link to some of the data work we're doing at the moment in terms of where we need to focus our resource initially. But alongside the hub model and those towns and locations that have been cited in the presentation you've got, as I said, there also will be a parenting offer that will be a universal parenting offer for all parents, and that largely would be delivered through our universal health visiting service and our community voluntary sector. So there will, even though there might not be a hub offer in every area, there will be access to parenting support, but that level of detail around the boundaries needs to be established through the strategy and further work.
Just for clarity, then you're saying that there isn't a hub offer in the West Somerset area?
Too early to say at the moment, because we're just doing that work. Our aspiration will be that there will be some parenting and home learning support in that area alongside integrated services. Yeah.
Claire, did you want to come in?
It was just to say that the government has recognised, I think, the issues in relation to rural communities and particularly coastal. So in the white paper, it does talk about two specific areas that they're calling specific missions. So one of them is Mission Northeast and the other is Mission Coastal. So I would expect the West Somerset Coast area to fall into that group because it has done historically, but we haven't yet got any information about which areas, coastal areas they're looking at in terms of investing in education opportunities for children in those areas.
And I think as well as that, and sorry, forgive me, just to add a bit, because I think I know where you're coming from, there will be different offers for different people as you go, and so no matter where you live, there will be access to family hubs in one form or another. I think, Rachel, forgive me, you were talking potentially about an app as well, and something. Do you want to just clarify what people will have access to and maybe how they might have access to it?
Yeah. So within the parenting interventions, some of the prescribed interventions from the DFE, some of them are digital. So a good way of supporting parents universally, all parents, is them having access to an app that has been evidence-based and has an impact on good level of development. So that would be a starting point so that everybody has access to something. And then we will build on that through a parenting pathway. So there would be more targeted support for parents in local areas like West Somerset as part of the pathway. And also families in areas such as West Somerset also have access to health visiting services, community voluntary sector services. And again, it's about joining those services up and ensuring that parents know where they can go for support.
I hope so with the white paper, because we're both rural and coastal, so perhaps we'll get double.
Thank you. Councillor Hunt, John.
Thank you, Chair. Thank you, Rachel. Going back to January, I asked you a question about, or both of you, you and Claire, I think, answered the question in the end. My concern was going into parents' homes or homes and teaching parents how to teach their own children, and that's a great thing. If you remember, my concern was about, is that then going to encourage home learning, which is just a personal view. I think kids should go to school and mix with other kids, but that's my view. So that's the first part. And just the second, just an observation, one of the things I know the government's been looking at this recently, where girls appear to be achieving far faster than boys probably always did. Perhaps we didn't have records in the past, but here we've got 77% against 63%, and a 14 points different is incredible. I mean, are we as a council, I appreciate it's a very difficult subject to address, but are we assisting the government's aims to address this, or are we addressing this ourselves? Thank you.
just come to your first point. I thought it was a really interesting point that you raised actually at the workshop, and it's something that has sort of stayed in my thoughts. I think at the time I said I didn't think it would impact because we are potentially looking at different elements of education. So particularly looking at parent-infant relationships and looking at attachment and that bond that parents have with their children. But I think at the moment, as I say, you planted that seed for me. So it's something that we would have to monitor. Your second point, I'm just looking at, could you just reiterate it? Because I'm just looking at Amelia and Claire and just looking who is best to answer that one.
It was just about the imbalance between the education or the receiving of education between girls and boys. Girls 14 percentage points higher, which it's very worrying. I think it's probably always been that way, to be honest, but it would be nice if we could try and, is it more female or girl orientated work that they're receiving, perhaps the stories they're being told, that sort of thing. I don't know. That it would be lovely to see there was a solution so we could equal that up a little bit.
What I can say around in relation to this programme, that evidence has emerged sort of over the last decade, and that has been implemented into training for professionals and staff, so they are aware of it. So there's that gender divide. There's also other factors as well that influence development, such as the time of year that children are born as well. So I think if professionals are equipped with that information, it supports them in terms of being able to apply certain interventions to children. It's a really interesting point. Yeah.
Amelia, were you looking to?
I was just going to say that the obviously when we track outcomes at all stages, and we'll be talking about some of those outcomes later in this meeting, that's always differentiated, as you've seen, by different groups of children. And that is a kind of a core element in terms of professional practice in education, is understanding why different groups achieve, and those differences are kind of, they'll be balanced out across a cohort, but they won't be identical in any school or setting. So you will see kind of much narrower gaps. But that kind of interrogation of attainment and assessment outcomes will always be looked at school level. That'll be part of our training, that'll be part of the support that we give to professionals to make sure that they are looking at the data, they're understanding how that looks for their children and how that then tracks back into professional practice. But that is absolutely something that will be done, but it'll be done on a school by school or setting by setting basis.
And thank you for bringing it to the signpost. So I was going to ask, it was mentioned previously about early years training and potentially the offer that's out there and the take up in and around Somerset. Would anyone like to speak about that?
I'm not going to go into an enormous amount of detail because we haven't got our lead for that here, but we have done a significant amount of work in redesigning the early years program. We have groups of early years professionals come together in something called early years communities. And they have always been, or for a significant period of time, have been funded to deliver training for groups of providers. I would say that is variable in terms of how effective the communities are in getting that reach in different areas. So we are re-examining that. But for earlier settings in particular, the kind of heft of our program has increased in the past couple of years, and we have been helped by that because of the 30 hours. In terms of central support that we're able to provide, that has increased because we're no longer taking a 3% central proportion. We take a 2.5%, but the sum that is increased means that there is more money to go round to provide things like training. So the program is better than it has ever been.
Okay, thank you. Fran, did that answer? Sorry, Claire, you were looking. Did you want to come in, or did I?
It's just to say, in terms of the sort of the difference between boys and girls, the government in the white paper have not identified necessarily the difference between boys and girls, but have identified what they describe as disadvantaged groups where they wanted to level up. So they are saying that the school system needs to serve all children well, and they describe the highest proportion of disadvantaged children in terms of the children who benefit most from sort of stability in school. They list as white working class children, which is quite interesting, and children with special educational needs and disabilities, and say both those groups should be a real focus because they are not succeeding as they should nationally. You can see that in the local data as well, with too many children also who are coasting, if you like, in school, who are not stretched to achieve to their best potential. So it's not a gender divide there, but the government's very focused on the data that says these particular groups of children, so white working class, children with SEND and children who are not being stretched, as being a really key focus for these reforms in terms of making sure that those children are brought up to the level that they need to be so that they do achieve well.
Thank you. Francis, Councillor Nicholson.
Thank you, Mr. Chairman. I was very glad to hear the presentation and I very much what you had to say, Claire, about not one size fits all, that rural areas are different from town areas. There are a couple of things that I'd want to mention about sparsely populated areas. I don't think you're going to find large cohorts of deprived people in those areas because there are not large numbers of people. What you're going to find is deprived individuals or families in an area which is not necessarily deprived. Now that is really difficult when your thinking has to be at a population level, but it is something that's got to be looked at. A couple of things and questions. There was a mention of work with the VCSFE. I'd like to hear a bit more about that. I'd like to know how this works in with Connect Somerset. And just a reminder that the empty areas of the county or the areas that are difficult are not always coastal. There are other bits, and the other one is absolutely horses for courses. One of the things about availability for people in rural areas is the app. That's fine if you've got signal or internet access and can afford the data. The standard thing in my part of the world is to go down to Dulverton and sit outside the co-op in your car if you've got one, and in a doorway if you haven't. And there are people who are doing that all the time. It's a bit more complicated than that. So the questions are around VCSFE Connect Somerset and how they fit, and a bit about identifying individuals, because you're not going to be identifying populations.
So what we do know that the government want us to focus on disparities, but actually what we do know is there are children who are struggling and they are in poor households in very affluent areas, and actually they're the ones that do worse. So so we can't ignore that fact. We can't just focus on geographies. We also need to look at individual children as well. So the excuse me. So some of the work we're doing around the data is actually identifying those individual children, and that's from health visiting data, because that's going to be really important. We don't want to leave those children behind. Regarding the community and voluntary sector, we do not have a ready-made workforce that's out there delivering parenting, home learning interventions. So we need to look at that. Who's going to deliver these interventions? So we've got health visiting, we've got other services, but the community voluntary sector are going to be key for delivering some of the prescribed parts of this programme, but also key in terms of supporting some of the wider outcomes of this programme. Connect Somerset provided some of that scoping and asset mapping. Some of the Connect Somerset champions have been really helpful in this work, but we also need to think about how we, where we've got gaps in delivery, and how we support the community voluntary sector to provide services in those gaps. So that's absolutely at the forefront. This isn't a council programme, it's got to be a system programme. And your last point about digital poverty, it creates nervousness, and we had a a discussion last week with the provider for this digital app, and digital poverty was one of our key concerns. And it won't stop us from curing some sort of digital resource, but we need to think about the mitigations. So that is, how do families access this? So an example that we've done previously is our libraries loan tablets with these apps loaded up on them with available data. So, you know, that's just one mitigation, but it's absolutely a consideration.
Very much. Just briefly, I would welcome a more particular discussion with you outside the meeting about my own area, if that's.
Thank you. Councillor Cravis, Marcus.
Thank you, Chair. I must have missed the workshop. I don't know how I missed the workshop. When was the workshop again? Ah, I was away. Oh, I know why now. That's right. Either that, I thought my memory was going. Thank you for that. Obviously, I support what Councillor Hadley said about West Somerset. One councillor once said West Somerset no longer exists. I said, oh yes, it does. And it still does exist. It's still got its own local plan. It's still got its sense of place and community. And I also support what Councillor Nicholson said about her patch of West Somerset as well. Well, it's quite interesting to hear about hanging outside the co-op. But anyway, but that actually, on a serious note, that actually brings to point when it comes to data charges being so expensive. And I suspect it's probably one of the scandals of at some point in the future. I think it might become an absolute one of the scandals of the data charges and the mobile phone companies charge for data. And I think that's something that maybe the government should look at as well while they're talking about this. I've got lots of questions, and I don't. Obviously, I've already mentioned the Wellington, and one of my concerns as well is obviously we talk about locations, and you could come up with a location in Minehead, you could have come up with a location in Watchet, you could come up with a location in Willerton. That doesn't solve the problem. Or a location in Delverton, but it doesn't solve the problem that actually if you live in Minehead and you need to get to Willerton, then how do you get there? Unless you're nice and middle class and have a car. And yeah, that's not necessarily easy, especially if you've got young children, etc. Also, one of my questions would be that, eventually, I think, did I see somewhere the funding's in place to 2026? No, 2029.
It's 29.
2029. So that's only 3 years. So what happens in 3 years when we suddenly end up with no money, or the government takes the money away, or we could have a different government, could we, by then? I don't know. So, suddenly the credit card goes, and what do we do then? And I suppose then is how do we, one of the comments we get a lot from constituents, if that's a word for them, is, how much everything costs. And, you only have a look at them, when they see a bit of roadworks being done, how much that's being cost and whether we're getting value for money. How are we going to make sure that that money that we've got gets spent and we're getting good value for money, and it's not going out the door in other ways, and it's actually getting to the people who need it. And then I suppose it was asked who, when it comes to the physical premises that I see from the presentation there, that they don't have to necessarily be a permanent premises, and I understand that maybe with this council, capital is not necessarily always the problem, it's always revenue that's the problem. So but then who's going to make that decision? And I think what I would, well, again, like Francis said, I would welcome a chat, maybe separately, if I remember or find the time. But my concern I get, and I say it again and again in meetings, is we talk about this at the early stages and going through, but then it's the school's involvement, because I'm seeing at the moment too many 17-year-olds who didn't pass English and maths and then end up on a course they never really wanted to do, because again, infrastructure and transport, they can't get to Bridgewater with all the good courses they do there, and what will help. And so that again is particularly, sorry for being parochial, everyone, about West Somerset, but that's again a specific problem. So we've got all this money, we can do all this, and then it falls apart in other places. And how we, and this would be, I suppose, Councillor Redmond's thing about data sharing and how we do all that. There you go, I'll shut up. Thank you.
Because I'll bring the officer in, but I'll give you less. I was going to give you the sort of a political response in the first instance. Not that we do politics in this room, but I would turn your part of what you're saying about the money into a different way. We've got the start of a process that's being funded to help us put the structure in place. In future years, it's more a matter of having this new system embedded in normal working so that any political changes that may come along would be harder to unravel. So I would just going to, and then I'll pass over to officers for a more full, but as far as the West Somerset and the parochial stuff, let me just to be clear, we talked about the community asset identification, and that's going to be an important part about it. We're all going to know, and you then talk about where to. Well, the answer of where to is where you already have things, and until we know where they are, we can't. The system can't meet those bits. So that was just me doing my initial spot. I've just got go on.
Maybe even clarify, because talk about changing government, what could happen nationally. But actually, if we're looking at £1 million a year, and we look at the savings this council's hoping to make, can this council, can the executive, or whoever, look at how possibly we could future plan it, so actually we don't need the government's money in 3 years' time?
So the plan, the government's plan is that all this sort of funding for both family hubs, Family First Partnership, and some of the SEND reforms funding is all sort of front loading, so that it's very focused on prevention. So the aim from the government's perspective is that we can shift services into a preventative model, so that everybody gets involved much earlier to support families when things are at the start of going wrong. Obviously, prevention is a cheaper model than acute intervention, and it's also much more effective and much less invasive and traumatic for families to be involved with. So the ambition is that we move to a preventative model over the next 2 to 3 years across all elements of service, both in the local authority, and also the NHS 10-year plan is very focused on prevention as well, so that we can, between us as a whole system, get that support into children in school, at home, in health services much earlier, so that they don't escalate into statutory services. That reduces the burden, financial burden, on local authorities in terms of the costs in acute services, which means that technically, because we will not need so many acute services, that money can be recycled back into the front door, and therefore the government funding that is only, as we say, to the end of this parliamentary term, will no longer be required, because our base budget will be able to be reconfigured to a more preventative model. I have some anxieties about that in terms of whether that's actually going to work, because in an ideal situation that would work, and that's what we all want, to get involved with families much earlier, so that they get the support they need, they can live independently and manage their children independently without the need for additional support at home or at school. As you will have seen throughout the duration of the last sort of 12-18 months, the world is changing hugely, both locally and nationally, and there are some incentives, if you like, at the moment in terms of how families work and how families respond to government policy and things that are happening in the local community, that mean that families feel they are in more acute crisis than possibly they did 12-18 months ago. And therefore trying to work with those families at an earlier point is difficult, because there are other aspects that are nothing to do with the local authority that are causing families to feel under a lot more stress than they previously did. So we all want to work to that preventative model. We are working in the family hubs and Families First model and in the SEND reforms to try and implement that preventative model, but we will need a lot of support to be able to do that from members and from all sorts of other people in the community and the organisation and other organisations, to be able to provide support and reassurance to families that actually we will get this right. We will be able to intervene early, that they can feel that they will definitely get the support they need at that earliest point, to support them to be able to care for their children to be able to access school local to home in their local community for the vast majority of children. And it's both a a technical change in terms of change of service provision and how we provide services, but it's also a big hearts and minds change, because at the moment we have a lot of families who are distrustful of local authority services in terms of social care services, in terms of SEND services and schools, and we've got to help people feel more confident, families feel more confident that we will, as a system, with health and the VCFE sector as well, provide them with what they need at the earliest point so that their child gets what they need and they don't need to escalate this to the highest points to get the resources that they need for their children. That's the bit I think is going to be difficult.
Okay, thank you. Simon, Councillor Carswell.
Thank you, Chair. I did just have one question at the top of the page, but because I've been waiting, it's grown. Right, so I might make more comments than you want. Just about the whole model, I assume we're not a pilot and therefore other areas have perhaps done this already. So are we learning from those other areas and being in contact with them to see how they've done it and what they're doing? I'll go on from there. Just something that was alluded to that obviously I would object to because I did work in Sure Start, is I don't think Sure Start failed. No. I don't think it was a failure. It did an awful lot of good work. Yes, there were certain groups that perhaps tended to be attended by yummy mummies or middle class families. We used to call them yummy mummies. But equally, there was people coming from backgrounds who needed help, who could be integrated into those groups and learn from those other mothers. And also the family support workers did a lot of low-level social work, though the thresholds kept getting higher because of social workers' workload, that hopefully this new idea will do some of that work with the individual families. And of course, by doing that, it is the prevention and the early help that was bearing fruit with Sure Start that hopefully will do in the future. But unfortunately, as Claire alluded to, that although we all know early help and preventative action cost less in the long term, governments don't think in the long term. And that's the problem, because it'll take 10, 15 years to feed through. And yes, then hopefully there'll be less requirement for SEND, ECHPs, social worker involvement, because those children will have been addressed at an early age. One other point I just wanted to make was that you did say that each area would perhaps be less rigid than before and could do what they wanted. I suppose my only concern with that is the quality of delivery and the quality of staff has to be monitored, because even in Sure Start, I visited children's centres across the whole of Somerset, and I was astounded by the differing qualities of delivery and staff in the different children's centres. So yes, it's a good idea to be able to adapt, but you don't want to be so loose that the right service isn't given. Thank you.
Sorry, can you remind me what your first point was? I've got a few of them in my head. What was your very first?
Sorry, that was learning from other areas that have already.
Yes, that's a good one. So 75 local authorities were funded previously to get family hubs money in the previous administration. So we've got the learning from those 75 local authorities, and then we are one of 60 local authorities that are starting with this second wave of the programme, and we have various different networks to link with those local authorities. I think your point about Sure Start is really well made. I think it was only 2 years ago we got the report from the Institute of Fiscal Studies that showed the actual long-term impact that Sure Start had. Yeah, so we are building on some of that evidence. Your last point was
the by being not too rigid, you're in danger of not having the same quality of service across the piece.
Yeah, and that's one of my key sort of priorities, is quality. So we've got some regulated services in the system, like the health visiting service, for example, that are in people's homes, and there's quite tight regulation around them. And I think anything we do, any contracts or any grants that we offer to community voluntary sector partners or other partners would need that robust governance in place to make sure that everyone's supervised, there's the right training. So yeah, that absolutely is is a really important.
Thank you, Sam. Thank you for that. I'll jump in with a question before I bring Ruth in, but it's more a matter about what next for us. One of the things that we spoke about at the workshop is about some sort of communication strategy. How do we tell people as wide as we can that this is in place? Is that something that we're considering?
Yeah, so the really critical job at the moment is completing the strategy, so we can all articulate that to everyone in the county in terms of what our aspiration is. And we have got additional communications and project support coming on board, and we will have various different avenues to share information about the programme, from forums to newsletters, etc. But I think the end of March is that critical time for you all having the strategy.
So I think one of the things in terms of communication, I think as I said earlier, is we've not done any sort of significant communication about any of the elements. So family hubs, families first, all these SEND reforms yet, because as we've already said in this meeting several times, it's all been quite bitty and difficult to understand. So trying to provide some communications to partners, to the public in general, about something that doesn't appear to be a coordinated whole is going to be difficult for people to understand. So I think now we've got the SEND reforms and the white paper, as I said earlier, you can start to see the outline of what that jigsaw looks like, the framework of it. So we actually have a meeting tomorrow morning where comms are coming to start to think about what might a comms strategy look like that encompasses all those different areas, so that it is cohesive and families can see how those different elements work together and what the offer is for them and what's relevant for them. And for me, it feels important to do that in a way that is cohesive, that explains all those things together so families understand what the overarching offer is, rather than having some comms that picks off different parts of it at different points that makes families feel, as we all have done, quite confused about what's meant to happen, what are they able to access, and what that might look like. So if you would like to look as a committee at the draft comms strategy, we're very happy to bring that to a future meeting so that you can understand it. It would need to be probably the next meeting so that we can actually then start to deliver that strategy.
I've been making in them so from the workshop and what's happened today, I've been making a list of some suggested outcomes from this meeting. The comms strategy is one of them, because that links, I think, for the committee in a number of different aspects. Ruth.
Yeah, absolutely. Comms strategy, Chair, I agree, is essential for us to see. And also the fact that it's going to need to be a partnership comms strategy, because this is a partnership approach. We need to make sure everyone's giving the same messages. So my question was going back to what Francis was talking about earlier on about the voluntary and community sector. I was just wondering if we're going to take any of the learning from what's happened recently via Spark around smaller voluntary and community organisations being able to be involved in commissioning tenders, because obviously, although we're all talking about 3 million like it's a massive piece of money, it really isn't for what we've got to deliver. So we're going to need to be able to stretch our budget as much as possible.
Yeah, I think, as I said, I'm hoping that there will be opportunities, and they will be transparent opportunities across the county for delivery. So I think the work that Spark have done is really, really useful in terms of ensuring that everybody has an opportunity to bid for those tenders.
I think one of the important bits we need to take as many people as possible with us on this journey, so that we can make sure that it all works at every level.
Can I just add something else? I think also it is a limited amount of money, and we also need to influence the system as well to work towards what we're trying to achieve. So there's not going to be money for everybody, but I think we need to be influencing various different programmes of work for 0 to 5s to work towards those objectives that we're trying to achieve.
Okay, thank you. So members, I pretty much so I've exhausted those that wanted to ask some questions. I just double check in my list to see that we've covered the points that we need to. Okay, so unless there's anything else, I'll try and summarise things and see where we go with this. So obviously, the committee more than definitely welcomes the plan, the programme, the direction, and I would add that we're excited by the opportunities that it shows in front of us. We've talked about the need to be aware of different areas. So we've talked about rurality, the urban, coastal. We've talked about digital black spots and the need to do that. That's some of the reason why I think, and I know at a national level, the difference between urban and rurality has been highlighted quite loudly, and the need. That's why the toolkit is there. So what I've done as well, for those of you that are online, when you get home and look at your chat, I've shared the link, as you talked about learning from other people, to the LGA National Family Hub Centre. There's an online opportunity there where best practice stories, things different from different areas have been shared, so you can use that as a reference. But I know it's one of the things that our officers are involved with it one way or another in relation to that. I think forgive me for repeating it, but I'll do it anyway. But linking into the things we have already is something that's important in this, and also involving partners, voluntary bodies, and anyone that's there. And I've made a point about, so one of the things I think is important we need to take out of this is that we need to find a way to start a community asset identification process, because as I've said before, and we can talk to members around the room, and they will each have different bits in their area that work well and that don't, and we need to start mapping that, and that's linked to the comms strategy that we need to develop, so that we can start letting people know what our thoughts and plans are in relation to that. One of the points which we talked about was good levels of development, but specifically one of the things we may want to be able to do is find a way to share some of that data with members, because you're going to get a member from West Somerset and a member from Wellington or from different, about understanding how that fits. So that's another point that I think we need to do. I've talked about the comm strategy, program strategy, identify. Yeah. Oh yeah. Sorry. You talked about the best start in life strategic plan. That I would suggest would be something that the committee would be interested in understanding a little bit more as well. So that's something we need to perhaps consider. I don't think I've missed any points. I'll just run through. So just so that we can agree to what we're agreeing to. So I've talked about the draft plan of best start in life, the need for that to be shared. We've talked about a comms strategy and the ability to share information around that. That's a second outcome from today. The third outcome will be something along the lines of the community asset identification and how we do take that on board. I've then talked about localized GLD data sharing, so that's there. I think I've covered the points, members. Is there anything? So those are the main four substantive points that have come from it. If you're happy to, members, I won't go into too much. If you're happy to me to put those into formal words with our officers, etc., and then share that as some outcomes from this, and then if there's anything I missed, we can potentially add that, and obviously that will then become part of our minutes, so that if we need to change or add to, you can do that. Are you happy that that's a reasonable direction of travel, members? I'm not seeing anyone against anything. Thank you. So we'll take that as a decision then, if everyone's happy. Okay. Right, so thank you for that, Rachel. Thank you for coming along. It really is exciting. So I'll just do a soft shoe shuffle for a moment while your place is taken by our Director of Public Health to talk about the next bit of exciting things that we have as a council. For those of you that are, well, Alison's taken a seat, but those of you that weren't privileged enough to observe our Adults and Health Scrutiny meeting, there was an element of participation in that may come along at some point during the next item. So we move on then to agenda item 6, which is being led by our Director of Public Health. I just don't think there's anyone wants to introduce anything to it. So without further ado, Alison.
Good afternoon. As Lee said, I'm Alison Baum, the Director of Public Health for Somerset. We've been sat down for an hour. Yeah. It's not very good, is it? Up we get. We're not going to have to do any exercise. Just take a moment to loosen up those shoulders and relax. Okay? And don't ask me any difficult questions. Right. Okay.
Well, we have a public health officer in the room for us. Okay, moving on.
If you invite me back, we'll do a Mexican way. I can do it bell ringing. Advanced skill. Right. Afternoon, everyone. My name is Alison Bell. I'm the Director of Public Health, and I'm joined today by one of my colleagues.
Afternoon, I'm Pippa Symes. I'm a Public Health Specialty Registrar.
Okay, and Pippa and I have been instructed to take you through this report quickly. So we will do so. So next slide, please. One of my duties is to produce an annual report, which is part of my role around advocating for the health and well-being of our local population in Somerset. And so I am sharing this report and asking for your help, because actually our population is really physically inactive. They spend significant proportions of their time in sedentary roles, and it's having a really significant impact on their health and well-being, and therefore our service utilisation. So I chose this topic this year. I can choose any topic I want, because actually Dame Sally Davis, who was Chief Medical Officer several years ago, described physical activity as a miracle cure. It makes us feel better physically and mentally. It helps delay the onset of dependence on services and many health conditions, and it's something we can all do something about. So we're going to take you through a little bit of the detail briefly, but be ready to offer ideas or actions for how we tackle this challenge together.
Thank you. So we've talked about physical activity being important for our public health. What do we mean by physical activity? It could be walking, it could be running, it could be cycling. It could be going to the gym, it could be doing calisthenics. It could be doing your local park run. But that isn't all that physical activity is. Physical activity is so much more. It's about how we live our lives. It's about all the things that we do day to day. And that is what's really important. And that's what we want to really bring to the attention of everybody today. So you can see here on the slides showing the benefits of physical activity. These are stark figures for something that is so simple as being more physically active. A 40% reduction in diabetes because people are more physically active. That's phenomenal. The fact that there is only a 20% reduction in some types of cancer sounds like it's only a small amount compared to the diabetes, but actually a 20% reduction in some types of cancer because people are more physically active is something that we really passionately want to work towards. Of course, if we have a healthy population, there is going to be less requirement for healthcare services. But more than that, as Alison's already explained and mentioned, the fact that actually if we keep people independent and physically active later in their life, then it means they're going to be able to continue carrying out activities of daily living and maintain their independence and not require so many services. But we're here today to think about children. So if I may have the next slide, please. What are the benefits for children? From the moment that we're born, we start to move our arms, we start to learn to hold our head, we learn to roll, crawl, stand, walk, jump. All of that time as we grow as children into our teenage years, we are laying down the foundations of our body, so our bone strength, our muscle strength, our cardiovascular strength. The heart is the same as every other muscle. The more that we use it, the stronger it is. Children who are more physically active are less likely to experience obesity. They're more likely to have improved cognitive function. So that means that we're going to have improved outcomes for their education. And they're also likely to have better mental health. But it's not just the health benefits. It's so much more. For children who learn to be physically active, learn to move their body, learn to catch and throw and jump and skip, it means that when they see other physical activities, they feel confident to join in. They are confident about how they move. They're confident about being able to be part of it, which means that they join in, they're more likely to have an increased self-esteem. And it means that they belong to whatever the activity is. It might be walking to school, it might be walking up a big hill, it might be having a kick around at the local park, but it means they can be part of it and they can join in with other people. There are also real benefits for children who may have levels of anxiety or who may struggle to regulate their emotions, struggle with behaviour. Actually, physical activity can be a really, really good source for them to build bonds, build confidence, network with their peers so that they can have positive experiences. It's really likely that that building confidence is likely to be then taken back into their classroom where they potentially built relationships and will help them cope in classroom situations that might otherwise have been more difficult. Of course, physical activity and activities, groups will bring people together. If people are able to join in, they're less likely to feel isolated. The other thing about children and young people being more physically active is if that we can build habits into children when they're young, then it means that it becomes part of their life. It might stay with them through their teenage years and into their adult lives. And so what we do now will impact their whole future. So next slide, please. So how much activity is enough? You can see here really, really clearly that if you take somebody who's doing almost no activity up to somebody who's doing 100 minutes of activity a week, there is a massive increase. So our focus is to try to make sure that we can get the people who are doing the least amount of activity to do some more. It would be really great if we could get everybody to go and join a football club or to go and start hill walking. But the reality is that isn't for everybody, and we don't need to do that. What we want to do is focus on how we can get people building physical activity into their daily lives. So for children, that's things like walking to school, it's cycling to school, scooting to school. So can we make sure that their routes are safe and that the crossings are appropriate for those children? It's making sure that within the school environment, the teachers have the resources to know how to make sure that children can have movement breaks, like we just all stood up. Actually, it's really beneficial for children who are expected to sit at the desk a lot of the day. We can get them up and about a little bit. Making sure that their lunch times are really active so that they can run about and be more engaged in activities. I'm really passionate as well just to mention that children who have special educational needs and disabilities or physical disabilities, they already face additional challenges, and it's really important that what we do meets those children and make sure that they are able to be included and involved in the opportunities, because they will also benefit enormously. Next slide, please. So just a little bit of data. This is data, it's the fingertips data, which comes from the national sort of database. The black line is the national data. The blue line is Somerset. The reason for the green dots is because it means we're above the national average, and the yellow dots just means we're about the national average. Overall, there's some fluctuation, but overall we are in line with the national average. But the reality is that says that about 50% of children are physically or meeting the required amount of physical activity, which is 60 minutes per day. But that means 50% of children are not. May I have the next slide, please? If we just look very briefly at the adult data, because our children of today are our adults of the future. Currently, around 70% of adults meet the physical activity guidelines. I think it's our expectation that given physical activity rates in children is lower now than it has been historically over the last few decades, we expect there's a risk that these figures in adults could reduce. And that's why we're so passionate to work with children and young people to make sure we can increase the rates of physical activity, build the habits so that for the future we can keep people fit and strong. So in terms of, next slide please. In terms of the picture a little bit more specifically in Somerset, just some figures to show about 40% of children at primary school age walk to school, about 50% in Somerset of secondary age children walk to school. We know in the schools survey, a lot of the primary school children actually showed real interest in being able to ride or scoot to school. A lot of the teenagers, actually, their preference was to go by car, which is probably not a big surprise. And you can see in the data, actually, that the physical activity tends to drop off as you reach the teenage years. And that's really crucial for us because we want children to build the habits in their lives and go into adulthood, then your teenage years is the bridge to that. Briefly, the survey also just asked children what they felt were the barriers for them being physically active. And there were different answers for the different age groups, but the common themes were essentially that they lacked confidence, they weren't quite sure what to do, they were worried that they might look silly or they wouldn't be good enough, they felt shy, or that they didn't have time. And I think that really just demonstrates how important it is that we start with children young and we build those habits so that they feel confident and able to walk to the park, play on the climbing frame and climb up it, climb in the trees, walk with their friends, be outside and about, go to the youth club, and if there's a kickabout or a throw about, that they're able to join in, and make those activities fun. But more importantly, make sure that day to day, every day of their life, they're involved in physical activity and that they see it as an important and healthy part of their life.
So what we've done is we've given you a small insight into a gripping read. It's only 20 pages. So I'd ask you all to maybe have a look at it and come back with any questions. But what we're asking for the committee is that you endorse the 3 priorities that we've laid out. As Pippa articulated, our real priority is to get people that are not physically active at all. 20% of our adult population take less than 30 minutes physical activity a week. I don't know how they manage that. I don't know how they live in Somerset without being mobile at all, but they do. And that is going to have really significant health consequences. And so we really want to prioritise getting people that are not doing anything at all active. Our medium-term priority is to reduce health inequalities. There's a lot of data about the barriers people perceive or actually experience in engaging in physical activity. And some of that is to do with deprivation and resource, and some is to do with physical capability and groups not necessarily being as inclusive as they might be. So we want to tackle those to ensure we reduce health inequalities. And the longer term focus is really where I think the people in this room can help, because it is absolutely sustaining physical activity across the life course and really embedding it. Ali, you talked about assets in our community. We have lots of sports clubs, lots of opportunities, the park runs, park walks, junior park runs. There's lots of opportunities, lots of assets. And what they all tell me is they're increasingly struggling to get volunteers. And so they're at risk in the longer term. I think the issues for consideration, the last slide, is really that we need to embed physical activity in our lives. We need to role model that in our meetings. We need to role model it to our workforce, and we need to role model it in our communities. And with the shift of the system working in neighbourhoods, I think trying to make sure every neighbourhood, according to the needs of that population, so in West Somerset it might be more older people opportunities, in Bridgewater it might be more younger people opportunities, but we need opportunities for everyone in each community to engage in physical activity. So we thank you for your time. There's a list of assets on the next slide if you're interested in what you could access as a locally elected member for your community. So there's lots of things there. The Adults and Health Scrutiny said they were going to check if there was a health walk in their division. And if there wasn't, they were going to volunteer to find a leader to set up a health walk in their community. There's lots of other initiatives there that you might be interested in. And there's 2 slides worth of assets and resources. And then the last bit is an update on our last year's annual report, which was Trudy's last report. And I just wanted to flag that focused on smoking, but our schools resources for being smoke and vape free have recently been showcased as best practice in the Southwest region. So these reports, although I tease you a little bit about, I'm shining a light on something. We as a team commit to doing something about this. What we're asking members today is if they can help us go a bit further. Thank you.
Okay, thank you for that. Members, if you want to indicate if you want to ask a question, I'll do the first one. I'm sorry, Alison, just to pick. So you talked there about your 3 priorities, and your short term is aging well. And you rightly, during your discussion, talked about young people being given an indication that it's normal to do exercise so that they can, it's a good start in life. And forgive me, but this is a Children and Family Scrutiny Committee. What is your short-term aim for young people? How are we going to get them into the mode of doing things?
Yes, so this is obviously an all-age report, and so I'll tailor it to the audience. In the detailed recommendations, we want to make sure that our existing Somerset Activity and Sports Partnership, which currently isn't connected to our Health and Wellbeing Board, is connected to our Health and Wellbeing Board, and we systematically engage partners from across the life course. So, because at the moment it's a bit ad hoc, and SASP have done some fantastic work, but they haven't always received the support from this building that they could have. So we want to reconnect, particularly education partners, early years partners, to absolutely address the needs of children and families.
Okay, so I don't want to put words into my colleagues around the table, so I don't know what questions they're going to ask, but I think for us, one of the outcomes from this, apart from accepting the report, and supporting its drive, is to find a way to link better those resources that are available with the resources. You would have heard the discussion in the last element about members knowing best what's in their divisions, and potentially that might be an opportunity, because I'm a governor myself, so we have other governors and school governors around the room, of how they link into that. So one of the things that I might ask you is, okay, we will help if we can. How can you or your service help us in that? The way that is to share that information so that we can disseminate it.
Yeah, that's certainly something we can help with.
Okay, Councillor Clayton. Peter.
Yes, thank you. I played football until I was 50 years old, 52 actually. I've done London marathons, done all that kind of stuff, park runs, whatever. I've been waiting for 15 years for new knees. Okay, it's physical capability, isn't it? That is the thing. How are we going to put people right? I know this isn't the old person's committee, this is the young person's committee, but can we actually get people back into physical activity via somehow, all of us, you know, it's not young and old, is it? It's doing the right thing at the right time and getting it right.
Shall I respond to that? So we do have an exercise on referral scheme. So for people that have encountered health challenges, their transition back into physical activity, particularly after something like a heart attack, people often feel anxious that actually they don't want to strain their heart, or they feel worried about it. So there's a programme of support that we commission as a council to ensure those people get back into physical activity as part of their recovery. The outcomes from knee replacements are really, really poor unless you go into the operation really fit and healthy. And actually, as part of elective care, preparation and perioperative management, we are now working with the NHS to make sure pre-elective care is done in neighbourhoods, and actually we think about how to get people fit for the operation, so stop smoking, lose a bit of weight, and put a package of care in place for after the operation. So yeah, definitely keep waiting.
It's a vicious circle, isn't it?
Peter,
you know, if you can't actually walk, it's really hard to get back into.
Before you jump in, I just need to remind members that this is the Children and Families Scrutiny Committee before you start, and please let's not get into the my pothole's bigger than your pothole.
I thought it was all about me. Sorry, Chair.
So, Councillor Lovell.
Thank you, Chair. Living on a street that is at the ends of the school day is invariably blocked up with parked cars. I'm given the particular school, I really don't understand why anybody might consider going to school other than on foot. My question is, what are we doing to encourage schools to promote walking to school? 100%, and you know, I'm not criticising the schools at all. They've got enough to think about. But are there materials that we can put in school to encourage, to posters, anything to promote the virtues of walking to school? Thank you.
So that's a great question. And I think that getting children to walk to school or wheel or scoot is a really great way for them to start the day, both for their physical health, but actually for their mental health as well. It's both of them. There is an initiative called School Streets, and in a number of towns, they actually close an area near the school, so that the road is closed to cars, so that you physically cannot drive to the school. And in doing that, it means that it's safer for children to walk into the school. So it's easier to encourage parents, if they know that there aren't any cars, because it's quite stressful in the morning with lots of children and there's lots of cars around. You actually don't want to walk a long way if you think it's dangerous. But if there are no cars, because you've closed the most immediate roads around where there is the most congestion, it means that people can then park and then walk, and everybody, both the adults and the children, are able to walk and have that habit put into them. And where it's been done in some of the areas, the results have been really successful, and there have been pilot studies that have been adopted because they've been so successful.
I would just add to that as well. I think there's a lot of different behaviours going on. So sometimes parents are worried about safety, but also they're worried about getting to work on time. So I think it's having conversations with people and working through the barriers, and then trying to roll out some of those initiatives that we know do work. Because if you just roll out the initiative without doing the groundwork, they usually don't work as well. Yeah.
I would just put a small caution in. One of the things that is quite, it's not immediately obvious until you start looking at the numbers, and I'm a data geek, and I imagine some of you are as well, is that the way that when you see children going to school in Somerset, you might assume that they live nearby. When you start looking at the numbers, we have an extraordinary number of children who are traveling very long distances to go to school. And one of the reasons for that is that we have historically, we'll be talking about Key Stage 2 and Key Stage 4 in a moment, had an underperforming school system. And so parents, in trying to seek a school that they feel is going to be good enough for their child, have sometimes gone a very long way to do so. If we make them go a long way, then we pay the bus fare. But if the parent chooses to go a long way, they have to get that child there somehow. So I think we just need to sometimes take account of the fact that, yes, sometimes that child absolutely could walk, but for a surprisingly high proportion of children in this county, they are going a long, long way to go to the school that their parent thinks is right for the child.
Thank you. And I'll add a bit onto that. Having been involved with a school that tried to implement something like that, there were a number of parents that may not have been too happy about that. And in the same way, I think it's a brilliant idea. I think we should be encouraging it, and that's why I've already made a note to share. The reason I'm talking about sharing initiatives is because on the cycle to school day, for those that are able, it's a really great way to encourage them. And if we can find ways, so different groups have gone to schools and done repairs and stuff, making sure that they're ready. But also along with that, there are most of us around the room that will be able to show you our casework. And I'm willing to bet that a large number of that casework is around people not parking sensibly around a school and different things like that. So that there are multiple sides to that. But I think we need. One of the outcomes I'm going to suggest is we need to be in supporting initiatives to make it to make open young children's eyes to be able to do it. I'm conscious I've got 4 people to speak, and we're starting. We've got another few items left, so I'll bring Evie in, please. Councillor Potts Jones.
Well, thanks. That was a mouthful. First of all, I did hear comments about parents having responsibility. We've also got responsibilities, corporate parents. I love your comment about working with the school. But one of the things that I find with fostering teens, they don't feel safe. Whether that's our lived experiences or walking across town. I live in a pinch point between 3 senior schools. They don't feel safe. So it's not the school gate, the parking, and that it's the crossover of the walking. So what are we doing to look at those aspects, please?
So a DPH report is just to advocate
that we need to do more. So what we need to reach out to people is say, where do you see challenges? And what you've said, Councillor Potts, is you can see challenges with secondary school age children, and actually how can we resolve some of those issues? I think sometimes if you talk to young people about what those fears are, sometimes they're perceived fears, they're not real, or understanding the reasons for them. So it might be that the education forum can take that forward. It might be that there's a small group discussion, but we have to pull on the whole resource of the system to try and tackle that. And if we say, I had a discussion with Jane Shelburne Barrow, who I can see on the call, and I said, actually, when we place our children looked after in a home, we would never place a child in a home where the parents are smoking. But we place children in a home where there's no physical activity going on. So actually it's really looking at our corporate parents' responsibilities and saying, how do we embed those into our commissioning, and how do we support some of our most at need children to become more active? So I'd be interested in a conversation if you had some ideas.
Thank you. Councillor Hunt.
Thank you. What a lovely thing to talk about. It's rare that you see someone walking out, right, we're going to talk about this today. And this really is exciting. And it is very, very relevant to this particular committee. I appreciate we can only look at it perhaps from an adult perspective. However, if every bit of exercise I do, and I over-exercise, I do too much, I know that. However, the parents that I know that exercise quite often bring their children with them to whatever event that might be, whether it be tennis, pickleball, walking, or whatever it is. They bring their children with them. And I think if we can teach the parents that this is a great idea to keep fit, if they're able, we keep saying that, but it is if they're able, I understand that, but also you can make people who are unable, able in some cases, as you say, about perhaps a little mind over matter, not you. But I do think, for me, it's about, I got elected on the basis, my big thing is about loneliness, getting people out of their houses. And this absolutely relates to that too. Gets people out, gets children out, gets them to run with, play with, have fun with. All right, if they can't walk to school, they can't walk to school. There's a lot of time during the Easter break, during the summer holidays, that they can go out and exercise and enjoy themselves. And particularly if it is football, cricket, whatever it might be, if it's a team sport, what better way to learn to work with others than a team sport? And also it's very healthy. It's also quite well protected because you're with a large group of people. And quite often, all right, parents might have to drive them to that particular event if they can afford it. But let's look on the positive side for those that can, and there are a lot. The only thing I would dispute with you were the figure 70% of adults do enough exercise. I'm amazed at the figure being so high. I thought it was much lower than that, so I've learned something today. But please keep up the good work. I personally think this is a fantastic thing and will most definitely be supporting it in my local area. And councillors can do this too.
Thank you, Councillor. I don't think there was a question there, so unless anyone... So, Councillor Cravis, please.
Thank you, Chair. Yeah, it was very hard to read this report and think I'm not on adults and health and I'm on children and families. But I suppose John just touched on there. If you've got a healthy or an active parent, you're more likely to be healthy and active. That's a huge generalisation, but there might be some stats that prove it. I was in Climate Place the other day, and I managed to segue into Climate Place the fact that when Minehead had a swimming pool, I was 5 stone lighter. And my children used to come with me. And yet we were talking about preventative, we talk about the cost, and I'm being parochial here as well, again, but the difficulty for people in some parts of the county to access, say, a swimming pool in the West Somerset area is impossible because the council closed it. And it's never reopened. And yet, so there you go. And I think about the preventative method, and I'm going to forgive me, Chair, if I stray into adults a bit here, but obviously we talk about prevention. If the NHS could contribute to a swimming pool in Minehead, then actually I should think they'll get the money back fivefold, because I was looking at that list on the wall and I was going, yeah. I think I almost had bingo by the end of it. And I think there's a huge aspect there. I think also I looked in the report about health inequality and I didn't quite understand. I also think that should include health care inequality because
Councillor Craig, is there a question headed this way?
there will be. Give me a chance there. So I suppose the question's going to be is how we then make sure that in the more rural areas, things like active travel don't get forgotten about. In our area, we've famously had half a psychopath taken away from us and money transferred elsewhere. So how do we measure that? How do we stop that happening? And I suppose my other question was that health inequality or health provision equality. How do we ensure that just because you have a postcode that puts you at one doctor's surgery, and I'm not mentioning names here, but I've just transferred to another, is that how do you ensure that just you haven't got the postcode lottery of what doctor's surgery or healthcare provision you have got locally to say somebody who lives in a postcode that is just one number difference? So how do we deal with that? There must be loads of questions here somewhere along the line, but I'll leave it at that. Oh, can I just say though, Chair, I saw somebody from SASPA community thing in Minehead and how excellent it was, how informative it was. And if only, and I felt almost ashamed that actually as a local council, I didn't know. And how do we make sure that that message gets out there to people who don't just happen to turn up at the Minehead community event, because there weren't many members of the public there.
Thank you for that. I'm just conscious that you may be asking the Director of Public Health to comment on the availability of doctors' places within the county, and it may be an area that I'll allow Alice. I'll ask Alison to answer what she can, and then we'll look to move on before we start getting into trouble.
Okay, so I think there's 4 points. Regarding the swimming pool in Minehead, I always remember doing the work for West Somerset Opportunity Area in Minehead, and I was staggered that there were children that were 5 and 6. They'd grown up in Minehead their whole lives, and they'd never been to the beach. Beach is quite a free, big swimming pool. I've swum in that sea. There are opportunities for physical activity in all of our communities. I do, however, share your concerns about active travel opportunities in rural areas. The evidence base for how you get people to engage in active travel in rural areas is really, really difficult. And that's something that all the academics, I've talked to lots of academics and they don't have a solution. SASP does provide a pain clinic in all areas of Somerset, regardless of which GP clinic you're registered with. So that is a good opportunity. And I think health inequalities is a really significant thing because the NHS is free at the point of use. And so in theory, we all have access. But actually, if you can't read the appointment that is sent to you because it's not in the language you speak, you miss out on your vaccination. And we have real evidence of that. So if you know of examples where people are struggling to access health services, actually part of my job is to advocate for those and address those. So talk to me afterwards. And the last thing on health inequalities is that whilst the NHS is free in theory, actually preventative services, we've had a real shift in our team towards making sure that our stop smoking service, our health check service, our health visiting service already did it, is absolutely accessible to those with impaired vision, impaired hearing, and is available in different languages and is specifically targeted to harder to reach communities. So our stop smoking service has got an offer in social housing, for example. So we've had a real shift towards, rather than telling people, come if you're interested, really taking the offer out into communities that we know won't follow Somerset Council on Facebook and won't hear of us unless we go to them and talk to them in their places. So.
Okay, thank you. Okay, members, I just conscious of time, but I've got 2 more people to ask questions and I'll look to move, well, take a break actually. But so, Ruth.
Change the narrative slightly. Sorry about this, Alison. What work are we doing with schools? So schools are really being pushed around that wraparound care. So before school, after school, what are we doing to make sure that what they're offering is encouraging physical activity, not just sat in a classroom watching a video or doing a Lego club or something like that? And how are we linking this in with the Youth Matters youth strategy that came out in December? Because actually, if we're saying one of our cohorts that are less active are teenagers, how are we using that to promote physical activity?
Okay, I think they're really good questions, Ruth. We're right at the beginning of this journey. I think those are areas that we need to take into that relaunched physical activity partnership and actually say who are the right partners to engage. We've seen the data that Pip has shown us is secondary school age physical activity levels just drop off. And actually we do have a captive audience in a lot of our schools because they have to wait for the bus to take them home because they travel a long way to schools. So I think we need to make sure that that wraparound care is something that's beneficial and it is doing health and wellbeing. So I think making sure education is part of that and alternative provision is part of that relaunched physical activity partnership is going to be really critical. And the second thing is I always learn something when I talk to you. I've written it down. I'll read Youth Matters and I will see how we can connect with our colleagues in children's services probably to see how we can make sure the physical activity agenda is joined up with the youth agenda. Thank you.
Thank you for that. Swalbeck?
Hi. I just wonder how much we draw from the examples around UK. And I don't know if you came across Chris Broadman, CBE, who is the National Travel Commissioner, Active Travel Commissioner. And I seen his presentation about engagement with one of the schools in Greater Manchester when around 60% of children were traveling to school using bicycles. And again, they took into consideration lots of different aspects as, for example, poverty and so on, and manage this to happen. But also I wanted to add is that it's also children with disabilities. And I'm not sure if councillors and anybody else in the room is aware, but we have a school in Somerset, which is Centre of Excellence. And that's the only school in Southwest which promotes Move for Children and trains a number of other schools as well, how to enable the children to be as physical as possible, regardless on their physical disability. And we've seen some of the children who came as a wheelchair users and with time and support and so on could use walking frames and so on. So that's kind of another good example to draw on. Thank you.
Yeah, thanks very much. We are aware of the work that Chris Boardman's doing in Active Travel England. They are or were a statutory consultee on every time a school loses a playing field, but they've been withdrawn from the list of consultees. So guard your local playing fields, please, for schools. Again, I would highlight, because we're a rural area, it's very difficult to replicate some of the work that we see in Manchester and in London to our local areas. But we keep on national calls saying we need solutions. We need to think about how we can shift more of our journeys to active travel. And actually in this building, we're responsible for planning. So actually what is going into planning applications, are we making sure if we're building a new housing estate and a new school, that we are building a community, we are building a means to travel within that community and to that school and to a green space. So I said this at Adults and Health, we have this within our control. So we really need to make the most of that power.
I'm just wondering if some of the things which you just were talking about could be linked with the head teachers' regional briefings or the local briefings, and if you connect with Heather Good and see if that potentially would be something, because I think other heads will be very interested to hear about this, and maybe that could be a point of conversation how the schools could support and promote further engagement with physical activities.
We'll certainly be linking with Amelia on this. We've already had a conversation, but if you could tell us outside the name of the school, that would be really helpful. Thank you.
Thank you. I'm just conscious that we need to be very, for me, I think the biggest bit there we just got to at the end. we all, Alison, need to be fighting for necessary infrastructure around planning applications. So that big exclamation mark on our note, we note that. But just a couple of things to bring us back. So we welcome the report. What I will say is that the ageing well needs to include how we can include young people and families into this, because that's what this is for. You've heard it's something we would like to do, but we need to be able to have the tools to be able to raise that. So I've written down that what are we doing to encourage schools to take part in this? I think that is something that we need to be pushing. We also need to consider the things that you'll hear us in this committee talk about all the time, but as a rurality, access to transport, all of those bits as well. But as well as that, in this instance, cost. People being able to afford to be able to do this. I know not everything costs you, but I'm afraid to say that a lot of the imbalance of access in here it's not just rurality, it's whether someone's able to afford to do it, whether they're driving somewhere and doing something. So it's the affordability for children and families, which I think is something that's important there. And it's been mentioned a few times, but I think, and I've written it down, so we've got how are we going to share this best practice? We know it's there, but so we've got best practice nationally, we got best practice locally, we've got setting stuff that's there. So the comms bit again, how are we going to share things? And the final bit for me, I think, Sławek, I did it, talked about setting meaningful, realistic objectives, because for one young person or young family, it might be good to get up and walk around the room, in the same way as for another it might be to be able to take part in, or even access football or swimming or all of those bits. So it's setting me realistic objectives, I suppose, would be the one for their members. I think, Heather, I'll let you come in.
Super quickly, this is a really good discussion. There's a few things going through my mind. One is that our last children, young people's plan separated out both, the children wanted to separate out their desire to see more effort going into their physical health, and exercise is a big part of that, and their mental health, although the two things actually work with each other, obviously, but they wanted it separate. So I think making sure that we stitch up together if we haven't already. I think the other one is about, obviously, as much as we can do with schools. We don't own all of them, but that encouragement. The other bit that's going through my head was, if I think about the work that goes on with our, and I'm not saying all exercise is about youth justice, but our youth justice teams that are working with, it's like old-fashioned youth work, really, and diversionary activities for some of our children who are the most they're out of school, they're perhaps most in the way of some harm, potentially. Exercise is one of the best things for them in terms of an exercise. So it's making sure we link up there too. And the last link up thing is, for me, is that I'm often in rooms saying the local plan. At the moment we are in the process of creating this labyrinthine, huge, enormous, all-encompassing plan for a whole council area, and that should be not only in kind of planning application levels. We should have our local hats on to say what's going on, but I think to also make sure that that part of what children need is actually being replicated when we're talking about placemaking in the local plan. So I think there's lots of places where we can, across the council, we can be working better joined up, I think.
Yeah, no, I totally agree, but it all goes back to affordability and morality and access. So I think it's good that we've had the conversation. We welcome the initiative. I know that everyone around this table will support it, but let's make sure that we're aiming not just at the old that need it, that young people need to be encouraged in the same way, because we've talked about it before. The benefits in the short term will minimise our need to be supportive in the long term. So that's Alison, and then we're going to go to a break.
Okay, I have two public announcements in addition to the report. In your inboxes, all elected members have received a brief about Somerset Health and Wellbeing Survey. We're really keen to hear about our population's challenges around promoting health and wellbeing. And so if you could publicise this, please, through your constituents, even complete it yourself. It helps inform our service planning, and we take that feedback really seriously. So if you could publicise that. And we have established a Facebook page called Healthy Somerset. And the reason for that is a lot of you say to me, I don't know what is going on. I don't know how to engage with it. If you are on social media, I know not everyone chooses to be, but there is a Facebook page which I'll send to colleagues in Democratic Services. And Lee, if you could follow us, because then we'll reach all your.
Okay, that's fine, but you also have to remember that not everyone has access to social media, internet, and etc. etc. So I would ask that the promotion for this is also made in a paper format so that we can share them with the places that we go to make sure that that's the case. And children, young people and families are the one that we're hoping to aim for, but
the health and wellbeing survey is available in different formats. The Facebook page, we can't replicate that in paper format because you'd be getting pieces of paper all the time. It's just part of our strategy.
No, I accept that, but we're potentially alienating areas of our communities that we could be able to be supportive. So
we have
need
posters in doctors' surgeries.
As a council, we need to be clear and recognise the fact that we need to get the best input into something like this. We need to give the best opportunities. I'm now going to call this item to an end because members, I'm happy to stop until 7 o'clock, but I'm sure that most of you would like to be on your way at a sensible, and we've still got two items which I know are going to overrun. So I just want us to be able to we're taking a 10-minute break, and I'm going to start again. It's actually a 9-minute break at 4 o'clock. Meeting adjourned for a moment.
Thank you.
Thank you. So for those of you, for everyone joining us back in, so just one final comment, which I was rightly reminded of for the end of the last item, which I think I need to make clear as well, is of course we should be not encouraging young people under the age of 16 to access social media unless it's in a sensible, meaningful way. I fully agree with that, and that's a really important point that I wanted to make. So moving on then, members. So to agenda item 7, which is our key stage 2 and key stage 4 outcomes. I will say, Amelia, thank you for taking the time to do this, but what I will say is we need to assume, because the members have read as much of the report, I will apologise to members to say that it was circulated a little bit later than we would have preferred. However, having our deadlines in the middle of half term were not necessarily helpful when it comes to education items. Going forward, though, what I will say is, Amelia, if you could, I'm just conscious of the number of the presentation and the time that we have available today. If it could be obviously cover the points that you need to, because it is really the members just asked to comment, so we no decisions attached to this or anything in relation to that, and we also have to send item to follow this. So Amelia, if you'd like to introduce yourself for those that don't recognise you. Welcome back, by the way. It's good to see you back in person, and over to you.
Thank you, Lee, and members of the committee. Yes, I will. You'll see for both this item and the next one, there is a terrifying number of slides. I will not be going through them page by page, but I will be taking questions on any aspect of it. I'm just expecting that you will have had the opportunity to delve into them as appropriate, and we can dive into any aspect that you would like to look at in more detail. What I am proposing to do is just in terms of this current item. Sorry, do I need to put them on the screen in order for people to see them? I haven't got anyone here.
So okay, pause for a second. So do we need Amelia to share them, or do you have them?
If everyone has access to them, I'm happy to just make reference to the slide number rather than putting them on the screen. Is that?
Yeah, that's fine. Do it that way, because the members will have access here.
So just by way of context, and we have gone into some detail with this committee, but it was some time ago. Just a reminder of some of the way acronyms that we use in the area of school attainment. So what we're looking at today, I want to touch on, we've already touched on this today, GLD, good level of development. That is the headline measure for children. It's an assessment done at age 5 at the end of reception. We'll also be looking at KS2, short for Key Stage 2. That is the end of primary school. Obviously in Somerset we also have middle school, so it takes place at the end of year 6. And we're looking at KS4, Key Stage 4. That is more commonly known as GCSEs. So we have headline measures, those are the key. There are other assessments we're focusing on these 3 today. So in terms of our good level of development, it's a good news story. We are above national, and we touched on that earlier today when we were talking on family hubs, and we have improved our outcomes year on year. We exceed the national average on all measures. I don't have to tell you this is good news, because children who start out well are of great probability of continuing well, and so that's a cohort that we have high expectations for. We're also, you will have heard, we have been set a very challenging target to do even better. As part of the government's desire to raise GLD across the country. Countries who are already ahead, they're asking to be even further ahead, and so we'll be pushing for that. So a good news story for good level of development and positive for Somerset. In terms of Key Stage 2, and you can see your headlines there on slide 4, we have been very far below national average for Key Stage 2 for some time. We have dipped a little bit in terms of RWM, which is reading, writing and maths. That's the headline measure, and it means children who have met the expected standard in all 3 tests. The slippage, however, is not because we haven't improved. We have improved in both 2024 and in 2025, which you can see in the covering paper, but the country pulled ahead a bit faster than we did. So it is not a decline in performance, but it is a slight increase in the gap because the rest of the country improved faster than us. But we still have 2 years on the trot of improvements at Key Stage 2. We are still a very long way behind. But if you look at the long-term pattern, we were declining for a significant period. We have turned the corner and have started to crawl back up. It will probably take a decade before we close that gap. In terms of Key Stage 4, you can see some of those trajectories. So if you look at slide 7, we have Key Stage 4 average attainment 8. Attainment 8 is your score for your 8 GCSEs as an average score. So it's not a progress measure. There are no progress measures this year because progress requires a comparison to the year before, and exams were not done in COVID. So there's no progress score. Attainment 8 has traditionally been a lower scoring area for Somerset compared to progress 8. Because if you don't do so well in your Key Stage 2, then your progress is easier to achieve relative to that. Attainment is a hard comparison regardless of where you were. But
if you pause a second, Ayesha's put the slides up so you can talk to your slides now.
So attainment 8, we have improved 2 years again in a row and narrowed the gap with national from 3.2 points to 2.8 points. So really good news on that harder test at GCSE. And for English and maths, grade 9 to 5. So again, decoding what that means. Grade 9 is your highest score. Grade 5 is considered a good pass. There's also a 4, which is considered a okay pass. The government is now pushing for 5 to be the standard. But again, we have narrowed the gap with national. And the grade 4, the standard pass, we have slightly widened the gap there. So overall, the picture is an improving one. We still have a lot of room to close that gap. Disadvantaged pupils, you can see, however, how big, really big that is at slide 11, Ayesha. Really big gaps there, but we have, again, on Key Stage 2, narrowed slightly from 9.4 to 8.4. A long way to go. And for disadvantaged pupils on slide 12, that gap has widened slightly. Again, you can see how far below national we are there. And then around SEND pupils, again, an area we've got huge gaps, but that is an area where the gap is growing. So something that we absolutely need to focus on, and we'll be talking about the SEND CEF in a moment. But the average attainment 8 score, that's a bit wobbly. We haven't got as many pupils in those. That one leapt up last year. So the really different picture at Key Stage 2 and Key Stage 4. So that's a whistle-stop tour. I think if we can sum it up, we have a long way to go, but the trajectory has turned around. We've continued to make improvements. The improvements are small, but we do absolutely need to keep focused, particularly on children who are more vulnerable, those who are disadvantaged, and children with SEND. Those gaps, we have some areas where they are not yet improving. And one of the things we see is that sometimes that is delayed, so that children who have less vulnerabilities in an improving system, they improve faster. Those with more vulnerabilities take longer. But those are absolutely areas that we would be more concerned about, particularly children at Key Stage 2 with SEND. That's a picture we need to keep an eye on.
Members, if you'd like to indicate if you want to ask questions, I'll open with the first one. I was particularly interested to understand, you talked about the SEND gap, the children with special education. I'm assuming, so is that part of the next item that you're going to be covering?
So in terms of what we're going to be doing to improve outcomes for children with SEND, that will be part of the next item, yes.
Fine, so that answers that question. So one then, so Francis first, Councillor Nicholson.
Thank you, Mr. Chairman. There are two things here. One, I think I tried to read it properly, but I have missed what the good level of development is a good news story for Somerset, but I'm not clear what the gap is for disadvantaged children. So that's one question, and how important that is. The other question is, recognising this is a snapshot, so it is not the same children at Key Stage 2 who are being looked at it for good level of development. So when, despite there's no progress measures, there is something different about this. But we're saying at the moment, good level of development, we're doing relatively well. We're doing relatively badly, and relative is important in this, at Key Stage 2. So what's going wrong in schools? That the early years seems to be quite different trajectory from Key Stage 2 and then Key Stage 4. Those are the two questions.
Well, you're tapping into some of the great mysteries of education, why different cohorts do more or less well. One of the things and we will have seen this in some of the work that happened in West Somerset, the good level of development is much easier to shift because the children are much younger. So it doesn't take very long to get to that test at the end of reception. So if you have an improving system, I would expect good level of development to move faster, because in the period of time when they have to learn, the whole of their period of time may be in an improving system. Key Stage 2, those children have been alive for quite some time, and so as they're coming up to their test, there's the lag that they had earlier in their education will still be bearing on how quickly they can move ahead. So they would have to move ahead faster than other pupils who had been taught from an earlier age in a strong system throughout. So it kind of catches up with you. I think what is slightly more surprising is seeing some of those stronger outcomes at GCSE, because they've been alive even longer. But I think some of the issues that we have in terms of Key Stage 2 in particular, one, and I recognise this is controversial in some parts, but nationally the data around middle schools is sometimes that the way that test falls in middle schools doesn't always result in strong outcomes at Key Stage 2, and sometimes that has been an issue in some of our schools locally. And that's not necessarily always about quality of education. It can simply be about the way the school is structured, because it falls in the middle rather than at the end. but also because we have a very large number, and as you know very well, Francis, of very, very small schools, the speed at which a school can improve and also at which it can deteriorate means it's a very volatile school environment. So in terms of Key Stage 2, getting stability where you have consistent good practice across a small number of small schools, I think that's a tricky business. Whereas I think in secondaries they are slow beasts, but once they're on a roll, they tend to kind of stay on that trajectory.
Thank you. Simon, Councillor Carswell.
Thank you, Chair. I have to slap my wrist so I won't be controversial here, but I'm just wondering, Somerset doing poorly against the national average worries me particularly as we're a county with a particularly high percentage of white population, lower levels perhaps of English as a second language. So you'd expect us to be performing better in general. And I didn't know if there was a link between pupil funding and our performance, because pupil funding is a complex beast, but we seem to get less than a lot of areas, and whether that is linked to the figures as well, whether that links in nationally.
So I'll take that in two parts. So the first point you made was that you were asking about the cohort and whether having a high proportion of white British population, you would expect a higher performance. Actually, if you look at the data, and this is very consistent for a very long period of time, it correlates the opposite. So where you have areas with a very high proportion of non-white British population, particularly where that is lower income, they significantly outperform the white British low income population by a very wide margin. So if you look in some of the inner city areas, in terms of London in particular, but also in some of the other large cities, there's a huge disparity. And the low income white British population has for a number of years been one of the lowest performing educationally groups educationally. And so, some of our communities absolutely need intense focus in terms of their ability to compete as they go out into the job market and to gain the most from their education. So that's not an excuse. It's a reason to give this the very, very highest priority, because we cannot take that for granted. The support that is needed and the focus on education is paramount. I guess the second part of your question was about funding. Somerset is not a highly funded area. I think the issue around funding that I would say is not so much that the base funding is insufficient. It is that it can be particularly difficult, we've touched on issues of rurality, for us to achieve a really efficient system. So in school funding, it's not always, it sounds slightly perverse, but it's not always so much how much you get, it's how neatly the size of your school fits with the funding formula. So you will have plenty of money if you can have a really stable population of pupils that neatly fit into 30 in a class every year. And you're able to fit neatly into a 7-class school or a 14-class school or a 21-class school, and it's all very tidy. As a general rule, you will probably find that you're always quite well funded. And one of the issues we have in Somerset is around volatility of the population, around our rural areas losing children because of the birth rate, around having schools that have to cover multiple year groups and constantly change the number of classes and teachers that they have, and the ability to maintain financial stability in that environment is extremely difficult. So it's a more complex picture than it looks. Obviously, you can just hand out more cash, and we do. Schools do get recognised in the formula around rurality, but it's not quite as simple as that. It's more about being able to have a neat and tidy distribution of pupils, because the money follows the pupils, and the way we're organised makes it very difficult to balance.
So picking up that and moving it across, I suppose, with areas of large deprivation, etc., and funding, there's an element of take up of free school meals. And we say, is there it would be an interest, and I won't necessarily ask you to do it now. It may be interesting to understand the link between the take up of free school meals and attainment and how that works. Purely simply because there's Heather knows where I'm going with this. There's a conversation around the country at the moment about potentially some areas where language is a barrier to opting in and opting out of the free school meal option when it's which then by changing the system to opt out rather than opt in potentially will provide some additional funding through premiums and bits like that. So is there an analysis done on attainment against the take up of free school meals?
I haven't seen that for Somerset. What I would say, and I will touch on before the next item, the white paper. There is a throwaway line in the white paper about looking at changing the funding system to move to an income rather than take up model. So at the moment, unless you take it up, the funding doesn't follow. But we do have data on parental income in the system, in the state, as it were. So that is one of the proposals in the white paper, to change the funding system to track income, not take up. I haven't seen that data, or I haven't got the facility to analyse that with the pupil population that we have, where the take up is a particular issue here. But we have had conversations about whether there are other models of identifying and allocating it. It may be that things move on before we get to that point because something national comes down the line.
Thank you. Sławek.
Hi, Amelia. I have a question regarding the Key Stage 4 particularly, because I understand the position of small rural primary schools and how that can affect attainment. If we look at the Key Stage 4, attainment 8 score, and then maths and English a 9 to 5 and 9 to 4. We're really below the Southwest as well, and I'm just wondering what the Southwest, is it Somerset included in that data? Is it excluded? And if Southwest, it's in line with the national average, or in some cases marginally above the national average, is there some learning from our neighbours? Particularly if we look at Devon and Cornwall, they'll have a very similar landscape with geographical positions and so on. So I'm just wondering if there's anything which we can draw from other counties. And it's the percentage of disadvantaged children, the main dominator or the reason behind that difference between Somerset and the rest of the Southwest. Thank you.
Just a good question. I have absolutely no idea the answer to that. We do have groups where we kind of work with other colleagues across the other local authorities. And I guess if your question is which local authorities are attaining above who, because if we're dragging it down, who is above that line? I couldn't tell you that. I mean, I think that we could do that analysis. I think in my experience, if you're looking at kind of area-based performance, you've got such a mixed picture because it comes down to kind of the history you have in your area, whether you were previously at a good area and have maintained that. One of the things that we find is that, and we're talking to a local secondary head just the other day, she is in a trust with schools who are less like hers, and sometimes working with a school that is in a very, very similar situation, actually sometimes that can provide benefits, because if you were to identify schools who were doing really, really well, but their context was really different to yours, or they had, you needed to improve as a school, and they didn't, actually what you might learn from them might not be as useful as working alongside someone who is in a very similar position in terms of that performance, but was dealing with the same mix of issues as you. So I think that's, but I think that connectivity with other schools is definitely something that is improving in Somerset. I think over the past few years, the involvement in hubs, the working with trusts that are outside of the county, working across schools, and making connections through various ways of kind of school-to-school support, which I know your school is very much involved in, Sławek. That is definitely on the increase, but there is more of that could be done, definitely.
I'm just thinking that that knowledge potentially could give us more information, because I said there are some disparities where the schools can be in different localities with different context, but there could be similarities as well. And if we don't have that information, and I'm just looking at particularly if we look at, not the whole of the Southwest, but some of the counties which are having very similar geographical position, potentially similarities in this number of disadvantaged children, those potentially are a good comparison, even from the point, okay, we are in a similar position, or do they do something different? Just a thought.
A helpful suggestion, we'll take that away.
Thank you. Councillor Cravis, Marcus.
Thank you, Chair. I'm still thinking of my question. I still want to get to it off and not asking one.
I can move on if you like.
No, that's, well, actually, there was specific, I mean, I'll ask the question on the right agenda item now as well, because I mean, we get back to the maths and English, and I think, I don't know whether it was specifically about maths and English, we're saying we're behind and it'll take us a decade to sort out, or whether what that actually was you were talking about, but if it is a decade, then actually, is that another, I don't want to use the word generation, but another group of children who actually might be failed as well, because we get back to what I said earlier, if you don't have English and maths, then you don't get to go to one of the colleges and maybe do, you fail everything else, but you go and do a BTEC if you've got English and maths. And therefore you go end up on a course you don't want to be on, a course, and then you end up dropping out. And the one thing you don't want to do as a 16 to 18-year-old is drop out of college, because that messes you up when you decide you want to do something later on, educational wise. So if that is a decade, what do we need to do to bring that down? And I think that was an excellent question there, because it'd be quite interesting to compare, say, ourselves, not necessarily to Devon, because Devon's Devon, but there's North Yorkshire Moors, there's Cumbria. How are they're rural, how are they dealing with that? How are they dealing with the same issues that we are, and have they got the same issues? And we get back to, there was something we talked about earlier, bear with me. I did find it was interesting that I remember far back as 2015 talking about all the money going to the inner cities, and actually that worked. So I mean, the government hasn't got, it's not rocket science, is it? They put the money in the inner cities. Oh look, the inner cities are performing better than the rural areas. So why are they neglecting us? Are they neglecting us? Was it just a case of they get more bang for their bucks in the inner cities when they give their money? And is that actually a good enough excuse? And then we talk about the falling pupil numbers, but then we end up in a vicious circle, don't we? I'm sure you've all talked about it before. If we don't build houses, young people can't afford to live here. And if they can't afford to live here, because all those houses are getting bought by people from the southeast who don't have children, and we end up in a vicious circle. And how do we break that vicious circle, apart from then building it into the local plan and maybe not worrying about the landscape as much and building houses so people can live, which is contrary to probably what I said in the meeting last week. But anyway.
So just on the point around how long it will take, it might be faster. I mean, there might be acceleration. I think it's just important to recognise that we're talking about a system. We have 269 separate schools, 70,000 children, and the reasons for the decline that we saw, and it was 10 years of decline, were very complex and interconnected, and you don't change a system quickly. You have to work at it and work at it and work at it for a very, very long time. So I think there's a degree of realism here that says it took a long time for Somerset to get to the state it got to. It will take a long time for it to come back. The important thing is that it is heading back, because positive improvement breeds positive improvement, and the trajectory has turned, and we are now improving year on year and narrowing the gap in most areas. So I think for this committee's perspective, I would encourage you to keep holding our feet to the fire. But the critical thing is, which direction are things heading in? Because things that start getting better tend to keep getting better. Things that are getting worse tend to keep in that direction. So from my perspective, the most important thing is we were heading down and we were losing ground with national at pace, and that was accelerating. That has bottomed out and it is now heading up. That is the absolutely critical thing that must be maintained as a direction of travel.
Thank you. I was going to,
There was one other question actually that I've just seen. Can I just ask whether where there is the 3-tier system that needs to be scrapped and we have a 2-tier system?
So we have 3 areas of 3-tier left, West Somerset, Frome and Wessex. What I would say is that the work on 2-tier and 3-tier is that schools have been having and discussing that in the Frome area is progressing and very encouraged by the collegiality that we have seen and are currently consulting on that as a concept in Frome, but that's being very much led by schools. And we have had no concerns raised by anyone about the situation or the arrangements in the Wessex area. So I say Wessex is mainly Wessex Trust schools in that area, but in the Mendip area. And in West Somerset, there are other things that are preoccupying that area. There are a number of changes to trusts as we speak. As those arrangements settle, that may be something that is considered by those in that area, but it's first things first as far as West Somerset is concerned.
thank you. And also, I think it's a really valid question, and I think it might be a good learning point for the committee. So it might have an outcome from this meeting. Might be that we have a little bit of a briefing note, if we can, around the school, the way the different tier, the way that schools are structured in Somerset, because I think that there aren't any 3-tier schools in my area, so I would welcome the opportunity to understand a little bit more about that. So that might be something that comes out of here. I've got one more, and then I'm going to look to summarise and move on. So Ruth, please.
Thank you, Chair. So just for your information, page 45 of the white paper outlines the new arrangements around the free school meals and the direction of travel, which I think will help because people won't actually have to apply for them. They will automatically come, so that will be useful if that comes into effect. I think what my colleagues are asking for or saying, which is what I was going to say, is that it would be really helpful to see data from our statistical neighbours, not just England and the southwest, so that we can get an idea of how we fare with others that have got similar makeups geographically to us. My question is going to focus in very much around reading. So 2023 data to 2024 data saw a significant decline in reading, particularly for our disadvantaged pupils. And then there's been a further decline since then. So I'm really keen to understand what we're doing to encourage our children to read, because that's really important foundation for learning and lifelong learning.
So obviously those outcomes are made up of outcomes from the schools that we manage as a local authority and those that are run by trusts. So there are lots of things happening in relation to reading, but they will be happening in different organisations. So we are working with our local authority maintained schools, and there is a there is an hub, an English hub that is sort of part of the arrangements that our schools can access, and we do work with them. And both the English and the maths hub are increasingly well used. So there is kind of a locus for expertise there. We don't have a kind of specialist, a specific English expertise, but we do have an inclusive curriculum and teaching team, and the reach that they have had in the system is increasing all the time, and we have expanded the work that they're doing recently, as in last year. So they are doing more than ever before, but they are covering the whole curriculum.
Yes.
I think this might be an area that we'd be quite keen to see feature in the family hub's work, encouraging parents around reading with their children and getting those basics in before we even start in a school.
Yes, so thank you. So I think we've had a good discussion here. So just a couple of points. So those of you that are observant will notice in the chat, I've shared a link to a national tool which actually allows you to do the comparisons between different areas of children's, that's education, deprivation, and there's lots of it there. So that, so about halfway down the page that I've shared is a link to the local authority interactive tool, the LAIT tool, which is there, which is a really great thing. At the same time, Ali has shared some information about the consultation that's going on around 2 and 3 tier schools and stuff like that. We talked a lot. We talked about funding bases. We talked about the difference of rurality, the difference way that the council is. We talked about deprivation and how we should be looking at statistical neighbours. And as a theme, I think that which will run through all of our meetings is about sharing good best practice, how we can take other people's successful learning and work on and do that. But I think just Ruth, the point that you wanted to clarify was around what we're doing about encouraging young people to read.
Yeah, because we can see that that's declined. So it's what are we doing as a council to encourage young people to read? So I appreciate we've got Isham and we've got Boolean that's supporting to drive up standards within school, but what are we doing to encourage that? Because obviously we've got a whole network of libraries out there.
That's fine, and I'll take that. I just wanted to clarify, so I would take that as an outcome from today as well. But I think the results, depending with which eye you're looking at it, can have different impressions of where we are. The good news that things are improving, I think for me, including the term COVID still in a report this long after is still a bit concerning that we're making reference to something like that. But we're getting better, which I think is good. What I will say is that and I think the bit that I think everyone in the room will be able to agree with is that we need to be striving for the best for every pupil at every level, wherever they are in Somerset. And I think that is something that will run through this committee's points. So thank you for bringing the report. Thank you for the detail. Did you want to add?
It was just on COVID, so that's a technical point. Obviously, COVID is not responsible for outcomes, but there's a technical point that because there were no examinations during COVID, that's why then the government has not published the progress. It's just an absence, a gap in the.
Thank you for the clarification. I appreciate it. Okay, members, thank you very much for that. So that's agenda item 7. We're moving on to agenda item 8. Don't worry, we've already done agenda item 9. So I know that some of you may have forgotten that. So agenda item 8 is our SEND self-assessment framework. I think, Amelia, it's you again.
Yes, so obviously, Chair, you mentioned that you would like just some comment on the white paper and SEND consultation that was published last Monday. So obviously, we're taking that into account in terms of our next steps. I'll just say just a few brief words about that and what that means for Somerset. So the government has published a white paper entitled Every Child Achieving and Thriving. That's a schools white paper. It's not just SEND, and it covers a very, very wide range of things, including family hubs, which you've heard about today. And it has also published a consultation, a 12-week consultation called SEND Reform, Putting Children and Young People First. Now, the timescales for this overall programme are in some cases extremely long. We are not anticipating any legislation until the King's Speech in 2027. That would mean aiming for implementation of statutory SEND changes from 2029. And the white paper makes reference to the expectation that numbers of EHCPs would return to this level we see now in 2035. Don't know if I shall still be here by then. That seems a very long way away. So this is not quick as a reform programme in some regards. In terms of some of the kinds of things they're talking about, it's very broad ranging, a revised SEND code of practice, putting in new packages around access to specialist education, a new funding schools directly around inclusion, something called Experts at Hand, and several billion for things like educational psychology, speech and language therapy, and occupational therapy. new enrichment and pupil engagement frameworks, and reforms to EHCP eligibility, which is likely to be the most heavily contested area and has already seen a great deal of debate locally and nationally. The government has given an indication of the kinds of things they would expect local areas to be doing immediately. We are expecting a direction around send reform action plans imminently. But the kinds of things that they have published, we have had a quick look, and they are all things that we are already working on, the kinds of things that they're expecting us to do immediately. And in some areas, we are ahead of the game. In some areas, we are nationally leading in things, for example, around the quality of our data picture, where Transformed Family View is supporting other areas in their practice, for example. This is not in relation to SEND, but of relevance to this committee. The white paper indicates that they are returning to a model where they would expect all schools to join a multi-academy trust. That has returned, but with a significant difference, with the indication that they would be enabling local authorities to set up their own trusts, which is something that has previously been discussed but was taken off by the previous government. There's also, and I think perhaps of interest to this committee, an indication that what they're describing as place-based partnerships will no longer be optional, and indicating they will be bringing in trust inspections, which is not a new announcement, but that trust will be required to show a community role as part of the Ofsted framework for trusts. So from a community perspective, that does sound very positive and in line with the kind of things that the standing panel, Education Standards Standing Panel, has been talking to trusts about. There's a lot in the white paper and a number of throwaway lines of things of significant magnitude, which we'll have to wait to see arrive. But what I would say overall for us as an education service within the local authority, we have not yet identified anything in the proposals which is significantly counter to what we are already doing or planning, which is really important for us as a partnership, because there is always a risk when there are significant national announcements that will mean us tearing up good work that we are already committed to. So far, everything that has been announced is in line with things that we are already doing or we're planning to consider. So that is really positive for us as a local area. And in some areas, some of our work is being recognised nationally, which is very positive. If we can then turn to the SEND evaluation framework. Which my machine has just died. Not connected. There's a sign that says that that's not connected. That's it.
Lydia, if I could just ask you just a brief question. I think it was about a year or 18 months ago, I asked you a question about Somerset as a council setting up its own academy and taking on schools that aren't otherwise academised. From what you've just said, whether I misheard you, was that counties now will be able to establish their own academies. Do you think that's, I mean, I remember the reason you gave was we like to offer assistance rather than actually, we're not good at managing things, we're good at, I think you said that anyway, something, but you felt that as a council, our expertise isn't running the schools, it's assisting schools or something like that. I've probably gotten that right round the wrong way. But would it be a case of we would have to set one up, or is that optional to the council?
Amelia, before you come back on that, because I was just conscious, I was going to say when we get to the end of this presentation, there are lots of questions around the white paper, and if we have one, then there's going to be 20. I'm just conscious. So one of the outcomes I'm going to say is that we ask the service to come back to us with a report at the next or the following meeting with a view to what this actually means. etc. Because as on a daily basis, things are evolving around the paper and becoming clearer. So that was what I was going to. You go on, if
Can I be slightly controversial? Can I ask that the partnership comes back and does a presentation, because moving forward it is very, very key that is a partnership approach to send, and I think it'd be helpful if the partnership came back and did a presentation.
point taken. And no, I concur. We need to be bringing as many people, and I just got to, it's a whole afternoon day in itself. So we just need to be careful where we go as a committee in how we do it. And we have to always remember it's the strategic against the operational elements, which we need to be clear, because there are different parts about that. Continue for now. So our outcome will be, I'll bring something to us so that we can have the proper debate.
I would also, I wouldn't want to just give my opinion, because the detail is the devil is always in the detail, and much of this is a very high level expression of intent with no implementation detail published yet. So if I can take us to the SEND self-evaluation framework, and as we say, this is I would say our esteemed colleague Ruth is very much part of the team who put this together. This is very much a partnership document. This is not a council evaluation framework. It is a partnership evaluation framework that's been put in place by, or has been created by a range of professionals from across the system. We have met with Ofsted and CQC for our annual conversation. I would say it was positive. I think given the number of challenges that we have in the area, I think we were, as you would expect, quite tough with ourselves and with our assessment of where we are. I think some the view that we got from Ofsted and one of the lead inspectors who was previously here at our last full inspection 6 years ago, his view was that even just seeing the range of work that is underway and seeing the way that the partnership now comports itself, he could see a significant shift from his experience in Somerset at the original inspection, which is positive. So this was been put together by the partnership and covers the 11 areas of the Ofsted and CQC framework. The partnership is overdue inspection. We've now over our 5 years, and so they haven't called today. They could call any Monday from here on forward. Just to give you a kind of a sense of, and I presume you've had a chance to look at it. This would also form the basis of any inspection kind of presentation that we would give to inspectors. So just in terms of the high level summaries, obviously we are flagging just generally that this is not a high performing county. We have a large area, and we have come a long way since our last inspection. We have a timeline there. We were inspected. Our last full inspection was in March 2020. We were re-inspected at a revisit in November 2022, where we went from 9 areas of significant weakness to 2. And those were then signed off in February last year. We also have had 2, we've had a joint, the JTI, which this committee has often heard reported. We have had CQC inspections in local hospitals, a youth justice service, which came to the last meeting, and a thematic review also last year. So we have seen quite a lot of the inspectors since then. In terms of headlines, there are areas of significant good practice in the county. There are areas where we have made really quite impressive headway, and areas where we are country leading. There are also areas where we absolutely need to continue to keep our foot on the pedal, and areas we would like to see improve. And some of those have been long-standing, things like exclusions and suspensions, which we continue to focus on. Hospital admissions around self-harm, alcohol and substance misuse are areas that have been of concern for many years.
And we know the number of children who are not in any mainstream or special school, and that's an area of significant focus. And we've talked before of the county about the impact of unmet need in relation to neurodiversity and autism, and the links to some of these areas. So overall, the assessment of the partnership is that we are doing broadly the right things, but the scale of the challenges is we need to continue to focus on these areas over an extended period of time, to embed, to test, to make sure that the things that we're putting in place are secure, that they are working, that they are having the intended impact, and then to tweak where it isn't. But I think our assessment is we don't need to make radical changes. We have made radical changes in the past. What we need to do is to implement them, embed them, and ensure that they are delivering, because this is not quick wins. These are big, large-scale system changes that we have put in place, and the effort required over many, many years is considerable. Now, there are throughout the pack, you can see that we have broken down each area of the inspection into what is working well, and there is a lot. I think we can be proud of how many positives there are there, but also what we are working towards. We have a send action plan, which the partnership covers actions across the whole partnership. We are currently in the process of revising that plan. We are expecting to receive a request from the Secretary of State for us to produce a send reform plan imminently, and that send reform plan will be an update to the current send action plan, which needs updating because actually a lot of the things in it are done. A huge amount of activity has been completed, but we also need to make sure that that aligns with our expectations for send reform plan, which will be the key to unlocking the funding, which we are estimate is in the region of £105 million. So this is not a small sum for the council. So I'm happy to pick up any of the things in the self-assessment, or take that anywhere you would like.
I've got some questions, so I'll go first. So welcome the report. I can see that, but to me, I'm saying, what are our priorities? What are the things we need to be doing first? So you talked about a send action plan, and then the send reform plan. So the send reform plan comes, I suppose, from the white paper. I think we need to put in place ready to gain stuff. So that's in the future. But now, where is the? You said it's under review. Where is the action plan with the priorities?
So until we have a new plan, we're still working to the current send action plan. But what you can see in the self-assessment document is that every section includes both what is working well, but also what we are working towards. So where it says what we are working towards, everything that follows is an area of significant priority for the partnership and will form the foundation of the revised send reform plan. So anything that is not yet complete from the current send action plan will be reviewed and either carried forward, or if it's no longer relevant, then it will be stood down. But you can see the priorities that have come from the various sources in the plan.
When? What's the time scale for this?
So we will be working to the government's time scale.
No, the self-evaluation. Unless I've got, I apologise. Unless I got it wrong, you said that you're currently revising the send action plan. When will we see the revised send action plan?
So the send action plan is going to turn into the send reform plan. So it will become it. We will do it on the government's timescales.
Okay, thank you for the response. I still don't understand where it is. So I'll come back, but let me just be a little bit clearer then. In the self-assessment, a number of things have been identified I suppose what we need to do better, or what we need to do to improve the progress. Where is the document drawing those learning points? Where is it? Do we have it?
No, because we are in the middle of creating it. So we have a send action plan that we're working towards. We will replace that send action plan with a send reform plan. I've met with the DFE today. The regions team don't yet know the timescales. They are waiting. That's I've got to come from 2 secretaries of state. So it's currently in that policy space. We haven't been given any timescales for the production of that. We will need to meet the government's requirements, otherwise we will not receive the £105 million. So we can't set our own time frame without having that, but we're expecting it imminently. I mean, it could be in mailboxes as we speak.
Thank you for the clarification. Francis.
Thank you, Mr. Chairman. Thank you very much for this. It's very helpful. I think there are so many documents that are required and so many deadlines sitting around that this is a nightmare, and we'll get there in the end, I hope. But I am a bit worried about the feel that this is very council based, and this is an area inspection. It somehow, and our language has got to encompass everybody else, or everybody else will shuffle off quite happily and leave it all with us. So I'm a bit worried about that's the tone of it that it feels like. I'm really pleased. This next one is I'm really pleased to hear you mention the progress that was made. The 2020 inspection with its 9 areas that had to be worked on immediately. I'm really glad that you stressed the amount of good work that our staff did to move us on from there. It was a formal come back and look at us. We should celebrate the fact that we did make changes. And I'm not sure that felt in the paper, that we were acknowledging that anything had moved on from there. But absolutely, first of all, circumstances change. Secondly, difficulties arise all over the place. There is an enormous amount to work to do. In among all the, so those are 2 points I wanted to make, and perhaps you might want to comment on. And the third one is in among all of the multifarious documents and requirements under and where does a send strategy for the partnership sit? Because our current one runs out this year, and does that matter? Or is it just going to disappear under all the requirements of white papers and Ofsted and government?
So we do have a send strategy, and that remains live. And I think the partnership is committed to revising the send strategy. I think we have to balance the imminent need to produce a plan, and we will need to deliver on that plan, because the risk to the council is critical unless we secure the funding to deal with the deficit situation. That is non-negotiable, and a really serious area of focus. I mean, I think what we need to do as a partnership, and what the partnership is committed to do, is to make sure that our plans are robust. We have the right collection of documents to bring everyone together, to get everyone focused on large scale systemic change, and to be focusing on the right things in a way that is transparent and robust. I don't imagine that we will have as much latitude as we perhaps have in the past to define what those plans look like, because it's quite clear that this send reform agenda is defining some of that. There will be templates, there will be timeframes, there will be things that it has to do and boxes that it has to tick. So I think what we will need to do as a partnership is to assess what latitude we have, and then within that latitude to make sure that whether it is a formal strategy document or whether it is about working strategically, that we are we are clear and we're focused on this a shared agenda. What I would say is, as you've indicated, a huge amount of work was done following the first full inspection, enormous amount of progress, and that was absolutely recognised by the lead Ofsted inspector, who was the lead Ofsted inspector in 2020, that he was really taken by how obvious it was to him the progress that had been made. So if that didn't come across, it absolutely is in the forefront of everyone's minds. This is a very different system. That doesn't mean that we haven't got huge challenges. And I think, as we said to Austin, to CQC, huge amount of progress was made, and then a huge amount of additional demand, need, and challenge came into the system. And so had that not happened, the trajectory we would have seen on outcomes, I think, would have been much stronger. But effectively, some of just maintaining our position has been in the face of, you know, rising challenges everywhere, and crisis impacting on children and families.
Thank you. Ruth.
It's really tricky at the moment, I appreciate, because there is just so much coming out nationally, and the direction of travel is a little bit muddy, I think is probably a good way to say at the moment. How, as a council, are you going to balance the reform plan, which in effect is going to take over from the deficit management plan, and how we are going to be able to keep the costs down rather than pay the money back at the moment, with the strategy, which is really focusing on what children, families, young people feel are really important to them, and schools feel are important to them, and other partners? How are you going to balance all of that together to ensure that we're still moving forward and we've got the direction of travel, not just the national direction, but the direction that we want for our families in Somerset and our schools in Somerset?
Magic trick? I mean, that is the £100 million question, £105 million question is what it is. I think that kind of thing is much harder when the government agenda is clearly not in line with what we want to do locally. I don't think that is the situation, because when and you know, as I said, oh, Amelia, you're looking a bit giddy. Well, you know, I think the fact that the agenda has not knocked over the important things that, you know, schools, families, you know, children have told us is really important for us in Somerset. I don't see things in this white paper that are problematic for us, and are going to create huge conflicts. Now, I do think that there will, you know, it seems the indication is that there will be quite a difficult conversation about eligibility for EHCPs. That seems the most contentious area. That is a conversation that will happen nationally, and we will simply, and that will be a long conversation as well. The other things look supportive. They are in areas that we have sometimes struggled because we haven't had funding, or there hasn't been a supportive enabling environment for that. So I don't see big clashes emerging from these recommendations from what we've been talking about as a partnership already. But I think that's a challenge for everyone around the partnership table, and for you know, myself and for the professionals in my team to look at the things that are coming out and to make sure that we optimize them for Somerset, that we identify the things that work for us, that we seize opportunities, that we promote the strengths that we do well, and that we minimize those things that don't work as well for us. That's the most important thing that we do, is we make it work for Somerset by being on the ball and work and being opportunistic in what comes forward.
Thank you. Final one then, Councillor Cravis. Marcus.
Thank you, Amelia. I was looking at page 71, and obviously there's all those nice little images of the good things, and then you're looking at the parent care reform and how much that's increased in size, which is quite incredible. But I wonder, and there's all the amount of hours and everything there, and then I wonder if there are any, obviously all that on page 71 is all the good things, and I'm sure they're not all good things that come out of the forums. And I wonder, are there any general, I don't know, general themes that are coming out of these forums? And also, can we react quick enough? Because it says it's an annual survey, but that's only once a year, where it could be something's going wrong that needs sorting out quickly. So are there any general themes, and are we quick enough to react to them from the parent carers forums?
So we, well, I mean, I can tell you that we definitely hear from parents, schools, families, children all the time. So there's no shortage of people telling us how unhappy they are, in great detail. and but this is it's a really serious there's some of the situations that we're dealing with on the ground are really very, very serious, and so it's something that is on the forefront of everyone's minds at all times. You see that we're learning from complaints, learning from tribunals, understanding the things that the crises that emerge and the situation in terms of children where we're intervening where it's really escalated. I don't think the issue is not hearing about it. The issue is having the capacity to be able to take a step back and to reflect on effectively a crisis situation, because there is a lot of good work going on. It is going on in a context of a crisis, and the number of children that we have who are in really, really concerning situations, and we're working very, very hard with demand that is rising at an incredible rate. This is not an ordinary situation. The rise in need is unprecedented, and so I think the challenge you've identified is real. We need to understand what we can learn, but it's not so much that we are not hearing it. It's more having the headspace and the capacity and the time to take a step back and to try and identify things that we can do differently and not just constantly deal with new crisis.
Okay, thank you. Members, thank you very much for your time. Thank you very much for the presentation. I think we a number of points we've covered as we've gone along, but I think the summary for this is going to be watch this space, because we'll see how it is. So we will work with officers to establish a timescale for a response to come back as to where we go with it. I would encourage members to pay as much attention to it as they can, because it is going to be something that will be impacting us at every level, and we need to do it. So, and I've shared a link in the chat to the full paperwork should anyone wish to look at it. So thank you very much, Amelia. Thank you for that. Thank you, members. That's the end of item 8. I am moving on to item 10, which we already done. So information items circulated between meetings. They will be recorded, and I'm not sure whether it's been such a short period of time. I don't think there have been any. So we'll just do that. So item 11 is our forward working plan. You will notice that's started to grow there. Jack, do you want to say anything in relation to it?
If you want me, Chair.
You could say no.
No, Chair, just to remind members that the next meeting is on the 20th of April. So you have a month and a half off, unlike last couple of months. And you have regional fostering hubs, government proposals, and end-to-end process on the agenda, as well as CSC reform, the children's social care reform, family help element. And then you also have a Somerset parent care reform update from Ruth Hobbs for that meeting, and that's the 3 items for that meeting. So there are a couple of items for May, and if I may also to remind the members about an item that was raised at the workshop, which was in terms of the pilots related to Families First and multi-agency safeguarding pilots. We did discuss for those to be brought back to the committee summertime. I see that Jane is online because she is working with the police together on that, whether it will be more appropriate bringing it in June or August. Okay.
So I think the important part about it is that we've had, as you rightly identified, a number of meetings in a short period of time, and that's some of the reason why I said let's have a conversation about where we are. So officers will have priorities that change. We've got priorities that change. So we'll make sure that we cover as many points as we can as we go forward. So members, as always, if there are any items that you think we should be covering, please make sure that you message us so that we are aware and provide as much information as possible. Anyone, any comments in relation to our forward work plan? Okay, there we go. So at 17:07, I declare the meeting closed. Thank you very much for your time. See members in the room and some of you on Wednesday
Yay.
for our full council budget setting meeting. Meeting closed.